Greetings, good evening, everyone. My name is Mike Allison, the village manager, village clerk, and in the absence of the village president, we would first establish a quorum, then we will have a vote on a president pro tem for the evening. So, let me quickly do the establishing a quorum. Trustees Hebda? Here. Cook?
Here.
Marquardt?
Here.
Schultz?
Here.
Schwartz?
Here.
And Williams.
Here.
We have a
Mr. Clerk.
quorum. Is there a motion to?
Mr. Clerk, I'd like to make a motion to have appoint for the remainder of the meeting Trustee Cook as President Pro Tem.
Second.
Trustee Hebda, second?
Yes.
Okay. The roll call. Trustees Cook?
Aye.
Marquardt?
Aye.
Schultz?
Aye.
Schwartz?
Aye.
Williams?
Aye.
Hebda?
Aye.
Motion passes.
Okay, we have a quorum and the meeting started, so would everyone please stand for the pledge? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, first item is citizens wishing to address the board, which would be on something other than what's on committee of the whole or that, because if it's on that, we can get to it. You can address it that time. No, Cliff? Okay. All right, then first item is under official reports, the village president's part of the report. We have the Heroin Symposium overview. Kathleen Burke, the CEO of Robert Crown Center.
Good evening, and thank you for having me. What I'm going to do tonight is I'm going to tell, I don't know how many of you know about Robert Crown Center for Health Education, so I'm going to do a brief overview, and then I'm going to talk about why we got involved in heroin prevention, and then I'm going to tell you more specifically about what the project that we're doing in your community is all about.
And if I could, before you start, if you wouldn't mind,
trying to figure out
no,
who's
sorry,
speaking.
yeah, it's all right.
That's only.
I'd like to say I saw the presentation when we did the symposium at the high school, and we've talked about it before here at board level.
Okay.
And being on the staff at Middle School South, we've already gotten your presentation, and the second one was done today at North. And I'm real happy and very proud of this village and our school districts for being out in front on this. As you're well aware, and everybody up here on the board, we've lost at least 4 young people in the last 12 to 15 months to this this new menace, and I'm familiar with your work, and it's a good thing that our schools are getting out in front on this, and we appreciate your help a great deal. And if there's anything we can do, you know, please don't hesitate to call. And I know anybody up on this board, I think I speak for everybody up here, that this is one of the things we really want to stay in front of.
Well, thank you, and thank you for having me here to be able to talk, because one of the most important things we can do is communicate about the problem and make sure that people are aware of it and aware of the issues involved around it. And the stigma attached to heroin is keeping it underground, kept it underground for a long time, and you can't fight a problem if people aren't aware of it. And we view heroin use as a community problem, and therefore it's so nice to see your community embrace this as an issue they need to deal with. So thank you for having it. So just to let you know, the Robert Crown Center for Health Education, we've been around for 52 years. So we're a long, freestanding health education center that deals with issues that supplement what the schools are already teaching in health education. We're located physically in Hinsdale, but we also have a freestanding facility in North Lawndale in Chicago, where all the services that we provide there are free of charge. And we teach at the Museum of Science and Industry. We teach Life Begins in collaboration with the museum. We teach over 80,000 children and adults a year. We deliver services to over 600 schools, and we're in 8 counties, so we're very much a regional organization. Our mission is to lead, educate, and motivate our kids towards healthy, happy, and safe lives. Whatever we can do to reduce the risks that they're going to encounter as they grow and develop, that's our job, is to take and teach them the skill set, the knowledge and the skill set in order to keep themselves healthy. Our values and what we believe in, and I think this is really important for folks to understand, is that first of all, collaboration leads what we do. We partner with organizations within the community, primarily the schools, but that's even getting broader, particularly as our mission incorporates more adults that influence children. We very much collaborate and work with partners. We're not competing with partners. We're there to facilitate and add what we bring to the table as a value. We strive to be excellent in everything we do. So that means that our programs are science-based. They're not value-laden as far as what we teach. It's about the facts and the science behind how your body works. And our sweet spot has primarily been middle school. Middle school is primarily the kids we've been teaching. We're now into high school, primarily because of the heroin issue and the importance that the transition years are when a child moves from either elementary school to middle school or from middle school to high school. That's a particularly challenging transition for kids to make, and the social experience leads them into areas that might be risky, and they're exposed to more. So our goal is to help them be prepared for that and to understand what's going to happen. We're about prevention. And one of the things you're going to see a little later is our prevention is primary prevention. It's not after a child has been using an addictive substance or has been sexually active or has a health problem. It's preventing those from occurring in the first place, which means we teach them how to not do those things. We want to be innovative, and our Heroin project is one of the most innovative strategies in the country as far as dealing with this issue right now. We want to be leaders in the healthcare field. Health education field. We were the first in this country for 52 years who developed this project. All the other freestanding health education centers modeled the way they do their business after us. We seek to be a diverse both staff and to be able to educate and work with diverse communities. So, and diverse from both a cultural standpoint, but also from a learning standpoint. There are children who have many different learning needs, and we seek to be able to meet those learning requirements. And in everything that we do, we have to be sustainable. So the way our budget works, so I know people are often interested in who funds us and what we're doing, is 25% of our income comes from fees that we charge for coming to our programs. We charge $5 for children who come to Hinsdale per head, and we charge $7 per child when we go to that school. I'm sure you can imagine that certainly does not support the programming that we offer. So I raised 50% of our annual budget. Our annual budget's around $1.8 million. And 25% of that also comes from an endowment. We have a small endowment where we get an annual draw. So our strategic vision is to have a healthcare content delivery system that's relevant to the folks that we're teaching to, sustainable so that we can continue into perpetuity, and effective for the children and those folks who influence them. This is about our approach. And when I mentioned earlier the primary prevention and collaboration, those are the key points to what we do. We teach about personal responsibility in avoiding health risks. We teach about healthy diets and exercise and rest. That's a positive way. That's the things you need to do so you don't develop medical issues down the road or chronic disease. Seatbelts and helmets, that's an example of a primary prevention. It's preventing harm while you're riding your bike or driving a car or doing natural things. So we avoid health risks. We help kids have positive outlooks on life and be able to manage the stresses that come into life. And we want them to be able to use healthcare resources effectively. So in the new healthcare law, it's really important that we understand it's not medical prevention all the time. We believe it's education, and that education really drives prevention. Some of the collaborations that I sit on are, we're involved in the Chicago Adolescent Health Access Committee, which is designing the response to the adolescent healthcare needs in the community. We're involved with the Aurora University STEM initiative, which means that we have started to integrate our health education programming into science, into math, into English, into all different curriculums, so that it's no longer just a health class that's going to teach kids the content they need, but we can incorporate it into many different of the common core that people are addressing now. As I said, the Museum of Science and Industry, we work with them closely. In fact, I spent 8 years at the Museum of Science and Industry as Director of Education, so we have a close collaboration because they're science-based, they talk about the human body, and they very much overlap on the subjects that we do. We have a behavioral health collaborative seat with the DuPage Health Department. That's another example of working to collaboratively plan how we're addressing mental health and drug use prevention in DuPage County. And we have a large heroin use prevention collaborative that worked with us to create this program. That collaboration consisted of other providers of service, whether it be treatment or psychologists, psychiatrists, researchers. We work with Celeste Napier from the Rush Behavioral Center. They're doing some outstanding things with neurobiology and the brain, and so much of what's driving our project is what's going on with the brain and what happens in the brain when drugs are introduced to that. So that's just an example of the kinds of folks that we work with on an ongoing basis. So in summary, our programs in grades 3 through 6, we primarily focus on general health and obesity prevention. So it's about keeping fit, knowing that you need rest, exercise, and water, and sleep, all the things that you need to build a healthy body. In grades 4 through 8, that's when we teach about sexuality and puberty, human reproduction, and disease prevention, disease meaning sexually transmitted diseases. In grades 4 through 10, our curriculum addresses substance abuse prevention. And we believe that starting in 4th grade is really critical, and that one of the things that our research had shown us is that we really need to be consistently teaching 4th, 5th, 6th, 7th, 8th, 9th, and 10th. There's no one perfect grade where we can distribute that information and it'll stay with the children because their lives change. I'm sure you can imagine teaching a 4th grader about substance abuse and teaching a 9th grader about substance abuse are very different. Their worlds are very different. We also have summer camps. We have Body Trek in our summer camp, which is a hands-on science camp that teaches kids how the body works in a very interactive way. We do parent support programming, we do community awareness, and we do teacher professional development. So here's what we've been doing with the heroin use. 3 years ago, a family came to us who's lost a grandson, a young adult who had passed away because of heroin addiction. The Ruby family believed that the only way to address that in a healthy way and a responsive way was to stop children from ever using the drug because it's so deadly, and that you can become addicted quickly, you can die the first time you use it, and so there was a real need if we were going to, his goal was to never have another child use heroin, that we were going to have to address it in a different way than we've been addressing our kids. So he came to us because we teach a lot of kids about substance abuse. When we looked at the research that talked about, well, what's going on with heroin, because that wasn't on our agenda either. We didn't teach about heroin because it's been off the radar. Nobody realizes that kids, young adults, are using heroin. There wasn't any good research. Most of the research came from the 1990s, and that's a whole different population. That was a whole different type of heroin user. The heroin user today are teens and young adults, and they're middle class, primarily Caucasian, kids who are experimenting with this drug, either because they've progressed from a pain pill, an opiate addiction, where they've become addicted to pain pills, which is the fastest growing. Prescription drug abuse is the fastest growing problem in this country. And so kids have gotten caught up in our propensity to use pills as the answer to all of our problems. And so pain pills are readily available. They're given for many different things, like dental work, children that are injured through sports, or in the cabinet of their medicine cabinets that their parents have, because we get those medications, we use 3, and the bottle sits there forever. We don't get rid of it. So easy access, easy use, quick addiction. Very expensive to do. Once you stop being able to get it from the doctor, well, then you go to the street. And the street price for prescription pain pills is really high. What's the next best thing? The next best thing is heroin. And heroin has become the drug of choice because the gangs it comes in from Mexico, and this is the new cocaine. It used to be cocaine, and I'm sure the police officers can validate this, that cocaine was the drug of choice, what was being pushed and sold quite a bit by the street gangs. Now it's heroin, and it's coming up, and it's being given to kids free. It's cheap. They're giving it because the addiction is so strong, and they create a customer really quickly. So on the supply side, we've been working with the police departments and the village officials to make sure that they're on top of what's going on from the supply side, because that's not my realm, and I can't do anything about that. But I can work on the demand side, the side that the children are creating the demand, and help teach them, their parents, and all of the community about the dangers of this drug. In that way, we're working as a team to try and balance the economic industry and drug use. Drug distribution is a huge economic power in this country. And that's a story we can tell the kids, because the kids don't realize that. They don't know why it's so readily available. They don't know why there's such an incentive. And so there's another cross way of doing that. So we identified what the problem was through our research. Kids didn't know what heroin was. They don't know how addictive it is, meaning they don't know that it causes this physical addiction. And they didn't feel that they got what they needed in their classes as far as health and drug prevention, because it was one class and they really felt that they needed it consistently across the board. The other thing is there are comorbidities called mental health issues, and so they're self-medicating. These are kids who have undiagnosed depression, undiagnosed bipolar disease, anxiety, social anxiety, issues that are hitting our kids at a younger age. They're going undiagnosed. As soon as they tap into an opiate that makes them feel more comfortable, they feel that they are using in a way that normalizes them. So they're using it to feel normal because they're not being treated for those issues. So our response to that research, and our response to the research that we had Roosevelt University do in our focus group and the work that we did with the kids, was to realize that we put together an educational strategy or a framework. Our goal was not to work with the schools and hand them a curriculum that was already pre-prepared and asking them to implement it. Because there are many priorities schools have. This wasn't the top of them. And knowing that resources are tight, knowing that Common Core was coming in, where students needed to reevaluate how they taught and assessed there, because No Child Left Behind was kind of going by the wayside. So we decided that the most effective way was to do a gap analysis with the schools, and talking to the health teachers and asking, here's what we know you need to teach in order to teach kids about heroin and brain science and addiction. You've got great curriculums already. Where's the gaps? What's not getting taught that needs to be taught? Based on that information, we then have assets that we've created, and you're going to see a demonstration of them. These are activities. Lesson plans are already developed. The activities, what you need for that activity. We have online activities that can be supplemented and just dropped in to the health curriculums. It can be dropped in to other opportunities where the kids gather, where they chat, other opportunities through science classes. But in addition to the kids, it doesn't do any good if we're not teaching the parents. because the parents need that information just as much. So part of the pilot requirement is that we address these same issues, the same content information, the same addiction problems, the same reason that kids are getting addicted with parents by addressing the normal strategies that you're using as a school to get parents together. So we go to report card night. We go to the night kids come back the first, when they do an orientation for the school. We'll go to athletic events. We'll go to the events where parents are naturally gathering in order to talk with them, because parents self-select out of drug community awareness programs for a variety of reasons. The other component that's very important is the staff within the school, because it doesn't do anybody any good if the kids need a resource and they don't have those resources available to them in the school, because whoever they reach out to, whether it be their social worker, their guidance counselor, their math teacher, or the lunchroom staff, everybody needs to know what this is about. And so we teach the whole community in the school so that everybody is aware of it, because those folks go back to their own communities and then are able to talk about what the issue is, reduce the stigma, and reduce and be a more educated community in general. The idea that kids who use heroin are bad kids, come from broken families, are not like your average children, the children that you raise, is wrong. We know that through brain research that it's a physical disease. It's a disease. The interaction between the drug and your brain creates the demand, and it changes your brain structure, and that's how it needs to be addressed for kids to become healthy. They need to know that, because it's not the same as other drugs. It's not the same as alcohol. It's not the same as marijuana. It's not the same. Opiates respond differently. So we have a pilot in 4 counties, one of which you are. The purpose of the pilot is to test our strategy by working with middle schools and a high school and implementing this curriculum assistance with the whole school. And we are having it evaluated by a group out of Iowa that is doing the formative evaluation. So everything's based on some assumptions that we've made, and we're testing it. And we're collecting scads of data. We're collecting data in Lake County here, in your school. We're collecting data in DuPage County. We're collecting data in Will County and suburban Cook County. So we will have a very broad perspective on if this is working or not, because, again, there is no other response to this kind of problem. We've also been lucky enough to start partnering with the booster clubs from the schools, who also have an issue, because athletics is a really important pathway to getting into some unhealthy behaviors, and there's incentives to stay healthy. And then what's helpful is if teaching the coaches and the kids what it means to be healthy and how to do it in a safe way. And then physicians. And physicians are not as up to speed on the impact of what's going on in the community. The ERs are, and the folks who deal are first responders. But the general practitioner isn't aware of some of the implications for, say, pain pill distribution, or reaching out to the kids when they're seeing there's a problem for mental health screening. So we're working with them in order to do that. And the Department of Human Services, from a federal grant, has also been funding this project. So we're well supported in the communities. So now what I'd like to do is ask Soraya to come up and give you an actual presentation of what it looks like from a teacher's perspective of what we're doing.
Okay. I'm going to escape out of this. Oh, yeah, I'm pretty short. Okay. I'm going to escape out of this, and I have fortunately pulled up our educators portal. This is through our website, through the Robert Crown Center for Health Education. This is using a specific login that educators involved in the pilot have at this time. And what you see here is we have a middle school curriculum and we have a high school curriculum. And these lesson plans and the corresponding worksheets, video clips, PowerPoint presentations are all available to the teachers. We have used focus groups to make sure that the material is age appropriate. So right now at Hawthorne Middle School North and South, this is the curriculum the health teachers are using here in the middle school, and then the high school, Vernon Hills High School, would be using this one. And again, this is specific. Obviously, one of the biggest gaps they did find in the research was not enough heroin-specific education, and of course, that's exactly what this is. So, for example, we've designed a, I think I did that too many times, a lesson plan. These lesson plans were designed based again on the research and the gaps, and this is the first time out that they're being used, so we're having the teachers evaluate them. This would be a guesstimated 40-minute lesson plan. There's an overview, goals. A lot of those goals are based on the gaps, and it's all laid out for the teacher to use. And then there's, of course, a corresponding PowerPoint. And the teacher notes, we found that we did these in PDF to make sure that they're more user-friendly. So we had to put the notes on in a separate PDF, because normally in a PowerPoint you can see the notes, whereas you can't see that in the PDF. So the teachers have the notes to explain the PowerPoint slides for them. And then, because this is a pilot and we are assessing everything, they can do a survey. And this is actually through SurveyMonkey. And they can assess each lesson plan each time they teach it, because every class is different, and maybe even the approach you use might be different. So we have a short survey for teachers to do each time they use it. So one of the other components we have, which I had pulled up already, is a social media case study interface, which is based on an actual recovering addict and his story, from how he went from exposure to use to abuse to addiction. And because what the research found was that students don't relate to somebody that's necessarily just a recovering addict, because they don't see themselves, especially from a preventative standpoint, they've never used. So they're thinking, I wouldn't be there because I don't plan on using heroin. So again, with the research, we found students don't know what the pathway can be like from exposure to addiction or use to abuse. And this is about Alex. He had, as Ms. Burke mentioned, a lot of times this is how some people are initiated into prescription drug. With prescription drugs, they are exposed from maybe a surgery, or in this case, dental work. And this actually is based on a true story. Alex was given pain medication for having his wisdom teeth pulled. And asked how you're feeling. He was tired. So this program goes through this initially. The Novocaine wears off, so they're going to give him pain medicine to help him. So mom gives him the pain meds, and wow, he feels great. And of course, he's given a prescription amount of pain meds. You will not get addicted to heroin or opiate painkillers the first time you take it, of course. Many people have had it for medical reasons. But what then happens is he's a sophomore doing wonderful in his sophomore year. He has a girlfriend. He has a job. And he finds what happens is he starts going down the wrong path. His friend, for his birthday, this friend reminds him how he enjoyed that pain pill, gets a hold of pain pills that somebody had for a surgery, offers him these things, and over the course of a year, you see where he's in the green, where it's not so bad yet. So he probably had that wisdom teeth pulled on September 14th, and it moves through this cautionary phase where now his grades are slipping, he's not showing up to work on time, things like that, and then he ends up getting into trouble. And what's nice is it's not a linear progression necessarily. Students can click on these numbers and find out what's going on. I hope it's going to let me do that. So at Chris's house, something's going on. Go to Chris's room. Hey, thanks for picking up this stuff. You know, this was also done with focus groups, and what they found was it was nice that students, I wanted to go back and show you that they even use things like friend book or texting and blogs, so that they use these focus groups to have students tell them what they would respond to. So students are able to do this in a non-linear way, but still can piece the story together. And it's instead of somebody telling them, this is what can happen and this is why you shouldn't do this, they can see how the pathway progresses. So this is a really important part of the program, along with the PowerPoints that talk about the neuroscience, as well as the opioids, which are the actual drugs, the how do you minimize risk, the risk factors and protective factors, and then of course starting conversations, how important it is to have people to talk to, such as at their school, the staff, and also parents. And then we also give this education to the staff and parents. So I just wanted to give you an overview of the portal and how wonderful the program is and is directed for the students and the adults involved.
What we provide through the pilot is a facilitator who assists and trains those folks in the school and is kind of the right-hand person to get this implemented, recognizing that resources are tight, and if we expected the school to just log on to, glob on something else, that wasn't going to happen. And so we're there as a partner, and that's been working very effectively. Plus, we really want to stress that the work that we've done has all been research-based. It's all been tested, and now it's being tested in use. And so the reasons we're teaching what we're teaching and how we're doing it are well-grounded in actual research. How do I get out of this? So that's our demonstration. Can I answer any questions? Did I cover all the questions you might have had about why we're doing what? I know I gave you a lot of information. That's my
Well,
problem.
and one of the things that I think is one of the surprises to a lot of people is that when you talked about the change in heroin, is that the image that people over 40 get of heroin is some guy on the street shooting up and that kind of thing. And one of the things about the new heroin is that it's much easier to get hooked because you don't have that fear of needles, because it can
Right.
be smoked, it can be snorted, it can be taken a lot of different ways. And they don't get into the shooting up until they're well into addiction, and by then they don't care about the
Right.
needles.
Right.
And that's one of the things that I've found in talking to maybe 40 as a cutoff point, that people don't understand that that's changed so significantly.
Well, you know what's really important is that, especially for any baby boomers or younger, is that we often, as parents, relate to our kids and think about our days in high school, or what the world was like when we were that age. And we seem to think that kids are experiencing it in a similar way. That's so not true. And first of all, everything's got, and our communication pathways are very different now, okay? We can communicate all over the world instantly. Kids' stress levels and pressure to get into schools, to succeed, to be multi-specialists in many different places, whether athletes, musical, art, drama, as well as science and mathematics, is a tremendous pressure on them. And the responses that are happening is they're just trying to live a life. And when something traumatic happens, it can trigger events and risks that developmentally kids are supposed to take. Kids are supposed to be, drawing away from us. They're not supposed to stick with us. But just because you and I may have experimented at some point, or knew people who did and turned out okay, does not mean that that's going to happen to our children today, because they start experimenting younger. We've got fourth graders drinking excessively, okay? So kids are starting younger. That impacts how it affects their body younger. It's really, really dangerous. And their brain development is affected. So and they're smart, and the more information we give them so they make healthier decisions, the better we can do. And parents need to know too. It's not as scary. It's just to let them know that the gangs have figured out a way to get around us, and they're bringing in, the drugs that are going to hurt our children even more. So.
Trustee Hebda?
The interesting point that you raised too earlier, you said how heroin used to maybe be the street drug and that it doesn't impact those middle-class families. And I was just talking to people at work today, they were coming to hear this, they say, oh, our area is okay. And it really isn't, because it affects so much of this, and the fact that it can go into any household anytime.
That's
So
right.
I really appreciate what you're doing in our community, and we're glad to be a part of doing what we need to do
I'm so
to
grateful.
keep it opened and the communication there for parents to be aware, so that we don't have more problems and more deaths down the
It
road.
usually takes the death of someone you know
Yes.
that to start people thinking they can relate to it, and so that's too late. We don't want to see our kids
But
die.
thank you for, it's a great, great program.
No, and thank you for being very out there and risk-taking and introducing this into your school systems, because it's not easy to do that. And so you're being very ahead of the game, and you're setting an example for the whole country, because there's nothing anywhere. And we've had schools come to us once they found out about it and wanted to be part of this. And we're not introducing anyone until we test it. And so we really appreciate your support and your participation.
Trustee Williams?
I just want to say I agree with Trustee Hebner and Trustee Cook, but number one, I applaud you for what you're doing, for what
Thank
your
you.
organization is doing. And I too think that parents is where we need to focus on very hard, not just the students, but the parents. Parents are kind of living never, never land, if you will. Not my kid, you're absolutely right, not my kid.
We all want to think it's not our kid.
Right, it's never going to be our kid, it's not going to be my grandchild. I'm brought back to reality from many, many years ago. I was in a committee on drug problems at the junior high. And the lady that headed the program during the time we were organizing found out that her sixth grader was an alcoholic. And she had no idea that the child was even drinking, much less
Right.
being an alcoholic. And it's right under her nose, you just don't realize what goes on. And
Your parents
unless
are the last
awareness
ones.
is there, we're gonna be in deep trouble. So
Right.
thank you for what you're doing
Thank you.
out there.
Thank you for having me.
Thank you.
And I'd also like to make sure we introduce the third member of your group back there with. Could you,
We couldn't
might as well
quite
get
hear
you.
that.
Come on, Margaret, so we can get you on some airtime up here and for the folks at home seeing this later.
Yeah. I'm Margaret Pither, the Student Assistance Coordinator at Vernon Hills High School. And I heard Kathleen present at DuPage last year and knew we had to have the symposium out here this year. And I was so glad the feeder schools were on board and we can do the pilot. So we're glad that they're in our midst and collaborating with us and helping us. So thank you.
We should thank Margaret, because it's because of Margaret that got us here, because we were trying, and until we have an advocate, we can't get in. So
Wow.
Margaret brought us here.
And
Great.
thank you for this time.
Thank you, Mike.
Thank you very much.
Thank you.
Any other comments from either board members or staff or chief or anybody over there on, no? Okay, all right. Okay, again, thank you very much. Next item is appointment of Brandon Atkins to Summer Celebration Committee and as grounds director.
Let me just mention that Brandon has worked as a volunteer for, at least 4, 5, 6 years, and he's the spouse of Jamie Atkins, who's the daughter of our former entertainment director, Debbie Malarski, who's not with us anymore. She passed away a few years ago. So it's really a nice family thing, and he's a very dedicated volunteer, and I'm sure Brandon will do a great job. So if you're inclined,
Do
if
you
there's
need
a
a
motion.
motion on that?
Motion and a second.
Okay.
So
So
moved.
move. Second.
Okay, we have a motion and a second.
So Williams and a second from
Schultz.
trustee Schultz, sir?
Any
Okay.
other comments or questions?
No.
Hearing none, a roll call, please.
Trustees Markwart,
Aye.
Schultz,
Aye.
Schwartz,
Aye.
Williams,
Aye.
Hebda,
Aye.
Cook.
Aye. Motion carries. Okay, next item is Village Manager Holiday Light Show recognition.
Just a few thank yous. One of them is a person in the audience for all his volunteer services. Yes, that would be you, Cliff Young. Thank you very much. I was out there twice, and I saw Cliff twice. So my theory is he was out there every night. So,
That's what I've
but
heard.
yeah, thanks to Cliff for all his work, really. And then on our staff, Lisa Fishback. Lisa does a lot of the promotion. Handles the license plates, which many of us bought, had on our car for, about 5 weeks. So that's great. And Dave, of course, Dave's people do get in there and do the work and put up the displays. And I thought it was the best, and that's my wife's analysis also. It was the best this year. And they really did a great job. And we got some really positive comments. Lake County Convention and Visitors Bureau, we did a promotion. And I think, John, it was the second highest year car numbers of all the years we've been doing it. So that was great too. And that's without the Courier and Ives addition of snow. So when you think about it, that says a lot, I think. So I think the promotion's working. But thanks to all those people and many more that worked on it. And if I could, Trustee Cook, one more thing. We had a VHAC stakeholders meeting. We'll talk more about this at some other date, but I just want to let you know, we met with the Park District representatives of the Stingers and the soccer group and Brian McDonald from the high school. And just basically, as you know from one of your committee of the whole meetings, the Park District is going to be keep the master schedule. And basically, the affiliates of the Cougars or the Vernon Hills Athletic Association are going to coordinate their schedule, give it to the Park District, and then the Park District will work with, adult groups that use the fields as well as the other groups, like if we have tournaments. Dave and I met with the Lacrosse America people today. So I just want to let you know that's our plan, and we're working through some of the issues on that. And I'm still waiting. I'll get back to you hopefully in about a month or so with the concession agreement too. We want to work with the Vernon Hills Athletic Association to renew that. I know they want to do that for this coming year. So thanks for allowing me that addition.
Yeah, and thank you to everybody that put on the light show. We've been doing that for years now, and it takes a lot of man hours in that, and it's a lot of person hours, if I want to be correct. But it really was much better this year, and glad to see the numbers back. Anybody else from staff have anything? Because my agenda doesn't show anything. I don't see anybody else. Okay, then the next item would be omnibus vote agenda. Is there a motion to approve items A through E on this agenda?
So made.
Second.
Motion is second. Any comments, questions, corrections?
The only comment I'd like to make is that, this is a pretty large amount that we have going this month, $2.5 million. But of that, the $2 million is the funds that we transferred, or transferred, I guess is the right word, to the Park District for their use in the purchase of the Y. And that was done, and things seem to be rolling along there well. So some good work, I think, that this board did.
I'm glad you brought it up because, yes, when you take a look at it and take a look at B, it's quite a large amount, and the reason B is, of course, what we've done. So.
Okay, so we have a motion and a second. Roll call, please.
I think they're pulling B.
Trustee,
I think are you pulling B?
No, I
Oh, I'm sorry, okay.
Okay.
looked at it, pulling, brought it up, and it was,
Okay.
that's why I just wanted to make sure it was.
Thank you.
Oh, okay.
Because of the amount.
Okay.
Trustee Schultz,
Aye.
Schwartz,
Aye.
Williams,
Aye.
Hebda,
Aye.
Cook,
Aye.
Markwart.
Aye.
Motion carries. Unfinished additional business. Approval of Kemper voucher list of bills dated January 9th, 2013 in the amount of $454.34. Is there a motion to approve?
So made.
Second.
Motion is second. Comments or questions? Hearing none, roll call, please.
Trustee Schwartz,
Abstain.
Williams, Hebda,
Aye.
Cook,
Aye.
Markwart,
Aye.
Schultz.
Aye.
Motion carries. Approval of village board board minutes of December 18th, 2012. Is there a motion approved?
Second.
Motion is second. Any comments, questions, corrections? Hearing none, roll call, please.
Trustees Williams,
Aye.
Hebda,
Aye.
Cook,
Aye.
Markwart,
Aye.
Schultz,
Abstain.
Schwartz.
Aye.
Motion carries. Okay, new business and communication. The only thing I'd like to do is echo what you said. It's nice to see that new sign up over there for the Lakeview Fitness Center. So that operation is now up and running from the Park District, so I'm glad to see that, and I think that's, I hope that's one of the things that'll turn out for the best, and Park District will continue to, grow that business there, so it's a good facility to have in town. Any other new business communication anybody has? Is there any reason to recess the board, or no?
No, sir.
Do we have
Executive session.
executive session?
Yes, there's items on personnel and on potential litigation.
Okay. So if there's no reason then to come back, then I'll entertain a motion to adjourn, and at the end of committee of the whole, we'll go into closed session for personnel and litigation, potential litigation.
Second.
Roll call, please.
Trustees Hebda,
Aye.
Cook,
Aye.
Markwart,
Aye.
Schultz,
Aye.
Schwartz,
Aye.
Williams.
Motion carries. Okay, I'd like to call the committee of the whole to order. First item is approval of the Village Park Liaison Special Committee of the Whole, VX Stakeholders Meeting, minutes of December 12th, 2012.
Motion to approve.
Is there a second?
Second.
Okay, we have a motion, a second. Comments?
On what?
Markwart motion?
Yes.
This is for one?
For one.
Okay, ready for roll call. Sorry.
Yeah, any comments, questions, corrections? Okay, roll call, please.
Trustees Cook,
Aye.
Markwart,
Aye.
Schultz,
Abstain.
Schwartz,
Aye.
Williams,
Aye.
Hebda.
Aye.
Motion carries. Second item, approval of Committee of the Whole minutes of December 18th, 2012.
Motion to approve.
Second.
Motion is second. Any comments, questions, or corrections? Hearing none, roll call, please.
Trustee Markwart,
Aye.
Schultz,
Abstain.
Schwartz,
Aye.
Williams,
Aye.
Hebda,
Aye.
Cook.
Aye. Motion carries. Third item, Vernon Hills Police Department, presentation of proposed remodeling plans.
Let me maybe start with that, and I'll start it out. The chief will, kind of segue in, and then, as we call them, the Hesners will present the overview. At this time, the presentation, it's really for your information. It's a rather large capital item, and as you may recall, it's repurposing, remodeling the existing police facility, not the communications facility, but the police facility where administration and officers are. And it's a pretty extensive reworking of the space. As you'll see, a lot of it is also upgrading things that really need to be upgraded, even if you didn't repurpose or remodel the building, the roof, communications, some of the electrical, things like that. So with that introduction, and we're looking at this as part of the whole capital improvement program. So again, it's tonight for your overview, and then Dave will probably either the first meeting of February or later in February, we'll talk about the entire capital improvement program, and this will be, of course, part of it. Chief?
I know we've addressed this item a couple of times in previous board meetings, so I won't go over the long history of how we got to be where we're at today with the two buildings, et cetera. Some people may ask or say the building is only 22 years old. Why do we need these changes? When the building was proposed in 1990 or 1991, it was stated that this would be the last police facility ever constructed in Vernon Hills. And I stand by that, even though I wasn't here at the time. The building is still the size that we need it. However, it wasn't specifically designed for some of the uses that we use it for today. For example, we've outgrown the locker rooms. I don't know what the size of the village was when the building was proposed and when the locker rooms were designed, but one of the things that's very apparent is we have far more female officers and female employees than we've ever had, and obviously were ever anticipated in the past. We have around 18 female employees, and I believe we have around 10 or 12 lockers. Not a whole lot of space. We have people that share lockers amongst each other. For an example, the gun cleaning station was put inside in the back of the men's locker room. Not sure how that was ever designed that way. And again, that probably wasn't done with a lot of foresight because it's difficult for the female officers to enter the men's locker room most times of the day to go clean their firearms and service their weapons. The investigation section was originally designed for 3 to 4 investigators. At times, we have 10 to 12 investigators working out of there. It's very, very cramped, to say the least. The same thing is true of the watch commander's office. That was originally designed for 5 people to work out of there. We have 12 people that work out of there on a daily basis, with 2 supervisors per shift and the officers in charge also sharing a desk. It is very crowded. Not to say there's not, well, obviously there's not a lot of privacy that goes on there. It's difficult to hold private conversations without locking the door, and that shuts off about 20% of the building for employee use. The record section, as you know, was moved out of our building, and it was moved over to the new building across the way, the American Family, as well as communications. We now have a rather large lobby. We have the old communications center room, which was built, fortified with bulletproof glass and very, very thick brick walls, as was the record section, which was built on the opposite side. There's roughly a third or more of the building that is truly vacant. We could use the space if the space was redeveloped, and I think that's what sort of prompted this discussion. Like I said, back in 2007, when the American Family building was purchased, and the communication center was renovated and moved over there, that left a large chunk of our building vacant. And the plan at the time was to always come back and do something with the space that was vacated. And because of financial concerns back in 7, 8, and 9, it was never done. And again, we're back to this now. And as I think it's going to be explained in a few minutes, and as Mike alluded to briefly before, there are a lot of things that need to be fixed just because the building is 22 years old. The floors in the building in many sections are completely worn out just from chairs sliding back and forth. The roof leaks, not quite every time it rains, but almost every time it rains, and I think a number of the trustees have been there and seen the plastic garbage bags taped to the ceiling in the corners to create a makeshift funnel so that the water drains down into garbage cans. Obviously, those get repaired over time, but new leaks spring up. This past summer, which was the warmest on record, according to the newspaper this morning, we were without air conditioning for 2.5 months. Not continuously, but it would work usually between the hours of midnight and 6 a.m., and then around 8 it would kick out, and we would be without air conditioning again until around 11 o'clock at night till someone could get out and service it. It's just the mechanicals in the building are getting old. We had to replace the entire water heating system 2 years ago, I believe. It's just like your home. Things get old and wear out and things need to be replaced. So rather than try to do those as piecemeal, as I think the Hesners are going to explain, a lot of that, the cost that you see is being folded in in things that need to be fixed anyway, and as long as we're doing those, we might as well look at the rest of the building. So with that having said, I'm going to turn that over to the Hesners then and let them go into their presentation.
Excellent. Good evening. That was quite a lead-in. Took a lot of my recap summary away. But one thing I do want to say is this is an ongoing process. This process started in 2005, 2006, and it's continuing on. Many of the concepts that were created in 2005, 2006 are still very relevant today. And but we have found through the interview process, as we discussed this with the building team from the department, that things have changed a little bit, and the department operates a little differently now, and they need several things. So what I'd like to do is start with some of the functions.
John has asked you to introduce.
Oh, I will do that. I guess this is on.
Look at,
Now it is.
there you go.
I'd like to introduce our team tonight. Tonight I have Kurt Hesner with Hesner Corporation, Earl Welton, and Rob Judge. And that's our team for tonight. And I'm Scott Hesner. So I think I'm just gonna continue on with this mic. As we were interviewing people for this particular planning effort, and the planning effort that we're talking about is what you're looking at in front of you. Primary areas that were discussed at length were watch command, investigations, roll call, report writing, the lunchroom, and the locker rooms. And it was interesting how these broader functions morphed into the other functions such as gun cleaning and armory and evidence processing to create this plan. Now, in each one of the plans in the plan that you have in front of you, this plan captures the courtyard. As we were working through the many concepts, it became evident that capturing this courtyard could be of great benefit to the building long term, actually short term and long term. And that if any major renovation effort takes place, now's the time to capture that courtyard. So as we started with this process and interviewed everybody to find out really what was important, it became very important that we address roll call and watch command as one of the primary areas of renovation. And when you're looking at the existing building, the area that you're looking at right now is shaded in the darker color. Those were the areas of the building that we were focusing on. So the administrative area was not focused on, and the Sally Port booking and lockup, the range, et cetera, were not looked at. Move on to the. Okay, so here we have the plan, and the primary functions of roll call, report writing, investigations, and watch command, we were trying to find the right place for them within this building. And we found out that some of the areas that had been vacated during the previous renovation work and expansion to the 740 building, and I'm going to refer to this building as the 754 building, and I'm going to refer to the other building as the 740 building. There was quite a bit of space within this building that wasn't being used, and we were looking at ways to modify the existing building to utilize those spaces more efficiently and effectively. What was also a big deal was, how do you do that while this facility continues to function 100%? So because there was enough space in certain portions of this building, the force could continue to operate effectively while portions of this project can get built. So we moved watch command, report writing, roll call, and up to the north and east portion of the building where there's a lot of vacant space. I'd like to go to the site plan right now. Part of this effort was, it was important for police officers to get from building to building a little bit more efficiently. And we knew that there wasn't going to be a physical connection, enclosed connection. But we discovered that there could easily be a more straightforward connection between the two buildings. Now, this connection is for a variety of reasons. Getting personnel from one building to the other efficiently, but some of the important things with this connection surfaced as when the public comes in, or when people are coming in to see an officer, or if an officer is called over to the 740 building. Right now, they leave the front of the building where the point is, and they walk across the street to get there. The people they're going to see, interview, talk with, have a full view of them walking across the street there as they're approaching that building. And they can get ready for them. There is absolutely no element of surprise or privacy as they walk across the street. So we were looking at different ways of getting staff from one building to the other. And so we came across with this midpoint where we can leave the westerly police entrance on the south face and walk across directly. And let's look at the 740 building plan. And the blue corridor at the top there on the left, that would be a new corridor in the 740 building where police officers could walk across the parking lot, go to the other one, walk across the parking lot and enter into the 740 building, and then walk up to records and interview someone or speak with someone that has come there to see them. That was an important thing. It's also an efficient way for them to get over to training. It's an efficient way for them to use the fitness facility and to bulk storage and long-term evidence storage. So let's go back to, that site. Now let's go back to the floor plan. Okay, so the elements of this planning effort, it took on the main components that we've discussed and a connection to the 740 building. I think what I'd like to do at this time is show you what some of these spaces look like. So we're going to go into the building now. Well, let's look at the exterior of the building. Yeah. Portion of this, the existing building as you see it now, go to the next slide. You have the atrium, and you have material called CalWall, which is translucent but not transparent. You have the turquoise finish on all the metal components of the building, and it really has a dated look, to say the least. And there's something that needs to occur here. So we were looking at the exterior of the building, and it's not as clear from my view, but I hope it's clearer on your view, where we're replacing all the CalWall panels with new glass panels. Some of these can have some forms of light and sun control, but regardless, they would be replaced and let a lot more light into the space. It would also give the building a considerable facelift as it moves forward, and it would really become more of an inviting space. We also created a separation from the parking lot to the building so that the public isn't as likely to want to knock on that door and go into that building. There would be landscaping placed in front of the entrance to that building so that the public would be directed to the 740 building. Now, as we have learned that no amount of signage can help people enough. So what happens here is people still park there and they still knock on that door to the 754 building, and that's unfortunate, instead of being directed across. Now, this slide's a little bit clearer where it shows an entrance that will be more police-oriented to the atrium. And what that will serve is as a quick in and quick out to roll call. That's where the officers will be able to leave roll call and go out to the squad lot and get into their cars for their shift. So let's start with roll call. Okay, so that is the entrance. Please excuse the lake behind the entrance. You're right. This is a shoreline facility now. But that is the entrance to the roll call space from the parking lot. And then this space here, continue to rotate, is where roll call would take place. So you have windows that have been replaced with clear windows or with sun treatment, some sort, but a much brighter, more vibrant space. You can look through and see the connection to report writing down the corridor to where the main conference facility is, and the door right there that you're looking at is the door to watch command. So it gives you an idea that you have a classroom type of setting for roll call. We did investigate a more informal type of setting where there would be a round table, a conference type table for watch command, for roll call. But in the end, as we interviewed more police officers, the way they would like it is a more formal start with more of a classroom type of sitting position, where there'd be a lectern or somebody in the front talking to the group that is about to go on their shift. Okay, now let's go into report writing. Okay, in report writing, it was determined to be important to have a relationship with roll call, because you have a shift going out and you have a shift coming in. So the officers coming in from their shift, keep on going, Earl, right there. The officers that are coming in from their shift would come in from the squad lot into that entrance, and they would walk by the group that is getting programmed for their shift. And then some can go into this area, write their reports. If they have certain elements that they need to lay out on a large surface, they don't have that now. They don't have any place to lay out paperwork or items. And this is a space where they can write their reports, lay out their materials. There would be a filing cabinet for each officer. Right now, they keep their work in their vehicles. And this would be a place where they could have a file drawer within the facility that is theirs, that they can use. that they currently do not have. There'd be likely a printer or copy machine in this space, but even greater than that, there's a direct relationship with the two shifts, the shift that's coming in and the shift that's going out. They interface, they talk about things that have happened over the last 8 to 12 hours, and there's a close relationship, but they're not in the same space. Okay, now go to watch command. Okay, that's the door to roll call. And you're looking through the windows through across the corridor to report writing. It was determined to be very important to have a visual relationship with all the spaces as people come and go. Not as much to have a direct vocal relationship or audio relationship between watch command and roll call. They needed a space to work. In these teams of sergeant, watch commander per shift, each shift has a sergeant and a watch commander, and they have requested, they like to work face to face. So each team would have a workspace that would have face-to-face workstations. This is where they could store their materials, which they don't have anywhere to store their materials now, or if they do, it's marginal. The two workstations off to your left, those are for officers in charge, and they can share those workstations. It was felt that it was important that those officer in charge desk positions be in the same space as the watch commanders. We're going to go to the other end of the room so you can see what these workstations are like for the watch commanders and sergeants working together. So these are paired workstations that would be specific to a commander and a sergeant. They would work face to face. They would have room for their materials. They could see over the top of the partitions, so they can have a visual connection to the corridor, to roll call, and to report writing. And it's an open space for them to work. Right now, it is an incredibly crowded space. And although these panoramic views might give an illusion of more space than there really is in the plan, there's more space than they have, but it's still pretty efficient planning overall. Now let's go to investigations. The investigations department didn't start out as one of the most talked about departments, but it became talked about quite a bit. And what we've got in this area is a location that needed to have a direct route from investigations to booking. So we've created a couple direct routes. So if they bring in someone to interview them and it turns out that they need to stay, they can go directly from the investigations department into booking. They also have two entrances to this particular department. One that is more direct towards where roll call is and where watch command is and report writing, and one that is more direct towards the remainder of the facility. And as they bring individuals in from the Sally Port and they walk them through, they can come in that westerly door, and the person they're going to interview doesn't have to be walked in front of the clerk or the commander's workstation. They can go directly into one of the two interview rooms that is right there, the soft interview rooms along that area. And or taken to the harder interview rooms. Another thing that's very important about this particular plan is there's a storage room in between the two interview rooms. Right now, the investigations department, they don't have any storage for some of their specific equipment. And they felt that it was really important to have a small storage room so that they could lock that up or secure it, and have to store some of their equipment in a space that's not on their desk, next to their desk, or in full view. So this particular view is looking, the commander's office for investigations is in the far corner. The clerk is straight ahead. There needs to be a direct relationship between that person and the investigators. And there's flexible workstations in this area, so if the department has more people at any one time, there's work surfaces for them to work on. The filing cabinets off to the right in this view offer a large surface on top so that some of the evidence that they bring in at times, they need to be able to lay out to inventory, and they don't have any surfaces large enough to lay this stuff out. For instance, if there's a large retail theft event and they take in a lot of clothes or who knows, they now would have a place to lay out and inventory all those items that they take in. This is the clerk's position, and we have found out that that person is very closely connected to the people who work in this department. And so they needed a very direct vocal and visual relationship to people who are there, and this offers that option to them. The doors, although they're shown here, don't pay attention to the material necessarily, it's just where they're located. There's a closet immediately as you enter into the space so that whoever's being questioned can remove their coat and it can be secured right there. The first door is a soft interview room, the second door is a storage room door, and then the third door is another soft interview. Okay, now let's go to the locker rooms. Okay, this is the men's locker room. And what it is, when you enter into this locker room, you come down this corridor, there's a place to wash off boots, there's a place to hang wet raincoats or clothes, some place where they can store things temporarily as they come in. If they've been out in the snow or whatever, they don't have to put that stuff right away into their locker. It can dry off. And then we're going to show you the different types of lockers that we're proposing here in this concept. In these lockers, each locker has a storage drawer below that could be used for anything from boots to files. It could be used as a filing cabinet. These lockers that we're showing are 3 feet wide. The officers have indicated they need a place to store their uniforms. They don't have a lot of room to store their uniforms, so right now the uniforms are hanging up all over the place in the open. And now with this type of setup, they could have a place. Also within these lockers would be electrical provisions so that they could charge their phones, their radios, whatnot within the realm of the locker. And that was also felt to be a very positive thing. So this is a whole new look for the locker rooms, and more private showers, individual showers versus a common shower area. And
If I'm counting lockers correctly, I'm only seeing 19 here.
In which side?
Yeah, in the woman's locker room.
That
And
is
you have
correct.
18 right now? So you're only planning on,
No, there's a second provision here that they're going to address in the 740 building.
okay.
So go to the women's locker room. So the women's locker room is very much like the men's locker room, just a little bit smaller. Definitely a lot newer type of lockers, a lot more room, more efficient, same functions. And this locker room would also have a place for boot washing and raincoat hanging. And they really wanted more place to store uniforms, whatnot, and so forth. So this would have that. Let's go to the 740 building plan. As there's quite a few dispatch personnel that are female, the two rooms that are shown above where the new records department is in this plan, can everybody find out where the records department is? There's two rooms shown in blue. They're smaller. When we talked about locker space, some of the people don't necessarily need a very large locker. Some of the people need a place to just change out of their clothes into the clothes they use when they're at work. And they don't have a lot of equipment that needs to be stored. So these rooms would be for that purpose. There would be smaller lockers in there. People could change in and out of their work clothes when they're there. And that's really all that they need, or all that many of them need. So each one of those has 12 lockers to just change clothes. They're too high.
Half locker.
Mm-hmm. And if it was felt during the design development phase here that they needed a full height locker, then there would be 6 full height lockers in each one of those. But that would be dedicated to the people who work out of the communication center, because they don't necessarily need, or it wasn't felt that they needed a great deal of space for their items. They need to change their clothes, a place to put their coat. So right now, the project as we have it is one that is addressing many of the needs that were first proposed in 2005, 2006, but with the opportunity that surfaced in 2007 with the 740 building, many of those police functions weren't addressed at that time. And if you look at it in the broad spectrum, what a great campus and what a great couple of buildings. You have a lot of space for the police department. You have a communication center that other communities are joining in with. There's a potential for other Lake County agencies to join into this campus to make it a complete police campus. And you have room for growth in the 740 building. And you haven't had to increase the size of the 754 building to meet the program that's needed by the police department right now. That's a pretty good situation to be in for this planning effort. I'm here to answer any questions that you all might have.
I guess I'll give you one, or maybe to the chief. So you've got the 6 workstations in the communication center. If we expand to service more clients, what's the plan there, and do we want to incorporate that plan now so that it just becomes a plug and play later?
That certainly can be done. And there are some indications that that may happen in the, 1 to 2 years. Our plan was to just take them one step at a time, because those costs associated with doing that would be passed on to any community that wished to join us that caused that to happen. Does that make sense? In other words,
Yeah,
we wouldn't shoulder the whole.
Potentially do it retroactively, though,
Could do that too. Could do that too.
'cause as long as we got the sledgehammers flying.
Well, trustee Schultz, what we,
Scott, if you want to point out.
yeah,
As you noted on the plan here, there's that office space
Yeah.
that's designated, so.
Right.
If that would happen, the space is available, it's just, don't do it until we would.
Yeah, we're actually going to seize the space, if you will,
Sure.
and room bank it as opposed to land banking. We're going to room bank some spaces to make that happen if we need to do that.
Okay. I guess I'd just like to see it as, alt one.
As opposed to continually coming
Utopia.
back and asking for more.
Well, but the thing is that it could be, you can be penny wise and dollar foolish if you don't long-term plan. It can cost you more in the future to retrofit something or to change something that you could have spent a few dollars now, because I think that's what you're getting at, right?
That's exactly what I'm
Spend
getting
a
to.
couple extra dollars now to make it cheaper
Right.
for later expansion.
In the long run.
In the
I'm
long run.
assuming
Yeah,
that's a lot
yeah.
of them.
And so I'd like to see it, that to make sure that we see that we put in that kind of, foresight into the planning and that, so that it, in the long run, is cheaper to do it that way.
I'm assuming there's a fair amount of heat sinks in those communication centers, so you're
Oh,
gonna
yeah.
wanna,
Oh, yes.
pre-plan the mechanicals to support that, so that it becomes, you don't have to go all the way back to the RTUs to bring the appropriate air mix in.
the VAV boxes in this building altogether, they're a challenge right now. Some aren't even functioning. So yes, that would be looked at. If in fact that area that's below the existing communication center is taken at this time, basically what you'd have to do is just make sure that those doors are removed and create space for future use.
I'd like to believe that, that we have done what you've just asked, that we have planned for the future, that we have all these things are all rattling around in our minds all the time.
Sure.
So I'd like to think that we have planned for the future and we have contingencies in place should that happen,
Right.
that we'd be ready to go.
But you're saying the lake is not part of the, that's not part of the plan?
But it's a great
I
concept.
think Target might have something to say about that.
Actually, it looked more like the Pacific Ocean. It really had a
I was
very
waiting for
sublime
the,
look to it.
One
I was
person's
waiting for
lake
the
is another
boat to
person's
pop up
ocean.
any
We were talking
moment
about
over
your
here.
request for a boat later.
And watch the budget when it comes out.
Okay, any other?
Well, yeah,
I'm sorry, I didn't see it, sorry.
I guess I'd like to know what's the project cost.
You don't
Okay,
wanna know.
Kurt?
That would help me.
While he's getting those figures out, I might say it's a beautiful presentation. The building is gorgeous. I think it's a little overly done. And that's before I got the cost.
Okay, what Rob is passing out to you right now, I did the takeoffs and the budgets for this particular project. And to kind of bring you up to speed on how I do that, I actually take those sketches and I do a per trade takeoff. So I look at it not from a square foot standpoint, but from a what that trade's going to have to do to complete its particular task. Now, the sheet that you have right now in front of you is the full range of the project. It is the whole 754 building. It is also any of the exterior site construction that we have to do the links. And really, one other thing that Scott didn't say was what this really does is the 754 building becomes the police side of the operation. and the public side totally goes to the communication side of the building. We also have the communication plan improvements, but Trustee Schultz, I would say that we have not, put in the dollars and cents, the additional seats for the additional communities in the comm center. This just reflects that corridor connection, the locker rooms, and any other miscellaneous things to land bank it, or room bank it, as the chief said. We also have in here the roof replacement. The roof replacement is a total tear-off and replacement. The roof itself is a 21-year-old roof. It is crazing, and your membrane is failing. Yes.
Is that both buildings or just,
Or
Just one building.
so the original 754 building?
The 754 building would be replaced.
What's the life expectancy of the 740 building?
We haven't been up on it, but when we did the work in 2005, it was in really good shape. And it doesn't have as many penetrations, ups and downs, different vertical levels. That is really part of the problem on the 754 building, because the technology has changed. You have many walls that you saw brick walls exposed where we would do flashing panels and those kind of things right now. The other building is flat.
What are the two roof systems?
One is a modified built-up, which is a 754, and the other is a single-ply membrane.
Ballasted, fully adhered?
They're I'm trying to remember here. The 740 building is ballasted for sure, and the 754 building, I don't think it is. I think it's partly, you know what I mean? It's in pretty bad shape. And I think it's had so many repairs that if there's much ballast left, you're not seeing much of it anymore. The other thing that's included in here is all the equipment costs. Many of the items of the furniture and the structural cable systems, the locker systems and all that. We did do the takeoffs on all that equipment. And then, of course, there's your designing costs. Now, one of the questions was asked that if we were to go ahead, let's say we were to go ahead today to design it and go through public bid, would be about 4.5 months. And that would put us for a June construction start. And as you can see, that would be an 11-month process. So it would go through 2013 all the way through to May 2014. And probably a majority of the construction funds would be extended more or less fourth quarter 2013 and the first 2 quarters of 2014. Now, if we decided to wait and say let's design it now, and let's not go out to bid on it until 2014 because of different taxing years and things like that, you can see what effect this would have on your numbers. It's going to increase your number at roughly 131,000, and that was based on a 3% inflation rate. Now, I will say, we are probably in the most opportune time to design, bid, and build something. It's the lowest number it's ever going to be. I do hope, and I think we all hope in this room, that we are at the end of this 5.5 years of a depression, or whatever you want to call it. And if that is the case, there is pent-up demand, and things will change. That number could grow. And I think our window, in my opinion, is really the year of 2013. And it might be the first 3 quarters of 2013, because there was even an article in Cranes that was indicating that, hang on, because at this particular point, things are going to start moving in 2014, which means the fourth quarter of 2013. That's an opinion. We hear a lot of opinions. But this cannot go on forever. So we have a unique opportunity if we chose to move a little faster. That will become a business decision on your part. And that's kind of what I have. We have looked at alternatives of phasing the project, and we do have some of those numbers with them if you're interested in it. I don't know if we showed any of that on the planning or anything like that. Did we?
We did,
Okay.
but we haven't asked them if that's what they would like to see.
Yeah. That's correct.
I couldn't hear what you said.
What Kurt just brought up was that we did look at this project in a phased way. We had to look at it as a phased project because a portion of the project is going to be constructed before people can move into it, and the facility has to operate at 100% while that's happening. So we have looked at it as a phased project. So, and we have budgeted or provided prepared cost opinions if we need to look at this in a more separated two-phased effort. The one thing that Kurt has brought up is as you work on a two-phased project, if there's separation between the phases, for whatever reason, it tends to cost more money because you have to remobilize, you have to restart. It's something that happens. It costs more. So if it is something that the trustees would like to see, we have this broken out into a two-phase project if that's something you'd like to see. We have that, we're prepared tonight.
You have it here tonight?
We do.
Okay.
Would you like to see it?
Yes.
Okay, there you go. I'll get it.
I guess during the interim, I have a question for Larry, is how would we finance this?
I guess two-part. I think if we do it, I think it would be bond finance, and probably the debt service on a 20-year bond would be $225,000 a year. As you know,
Say that last part again, Larry. I didn't hear. How much?
The annual debt service burden is about $225,000 a year.
A year.
You know, I'm still very, I'm still at some of my initial phases in terms of the long-term planning for this year. So I echo Mike's comments early on that, we're still developing our capital plan and the long-term financial plan.
225,000, that seems rather steep on $3 million.
Yeah.
Per year, over 20 years.
A little more than $3 million.
Yeah, three and a half, I'm sorry, plus or minus.
Okay, the document that you have in front of you right now is showing two phases to the project, and what you have on your screen demonstrates the two phases. The brown color would be the first phase that would be completed, and the green would be the second phase. We would complete the first phase, and those departments would move into it and would empty out that other portion of the building so that we could complete the second phase of the project. Now, in what you have right here in front of you is if you had again, a June 13th start of phase one, and that would be a 6-month construction period, and that if you wanted to defer that, to the second phase not starting for 6 months later because of some of the financing issues, that would be then starting in June 2014, and that would be a completion right around the January 1st, 2015. And then if you delayed that construction or the start of the project till 2014 and you phase it, and then you did the second phase starting June 2015, you would be completed with the project 2016. So it does drag it out quite a bit. Those are, again, very, very conservative projections on how much it would cost you more if you do drag that out, because if we do, like we say, have an economy that finally gets kicking, these numbers are going to change drastically.
Wouldn't you, excuse me,
Yeah, go ahead.
Wouldn't you do it in 2 phases anyway? By
Yeah.
that, I mean, you can't work on the whole building at one time.
No, you can't work on the whole building at one time, but you can
So you
encroach.
could do a phase in 2 separate budget years.
Not necessarily. You could go
You could
start
do
and
it
just keep
anyway,
going.
but you could start it
Yeah.
in October, November, finish it before the next budget year, and then start the second phase in the second budget year.
Yeah, you could if you wanted to.
And
Yeah.
it could still be continuous,
Yeah.
with 2 phases.
Yeah.
Thank you.
On a continuous basis, you know, we say conservatively 11 months, 12 months to do it, but you might pick up some efficiencies and you might be able to get it in a 9-month period if you start and just go.
And-
So trustee Williams, I'm talking here, trustee Williams, it can be, you know, continuous in 2 phases. It does have to happen in 2 phases, but it can be continuous over that time period. What these 2-phase options are, is they're separated by time.
Exactly.
But I
There's
think
a-
what
there's a
trustee
6
Williams
month.
is talking about is adjusting the start time
So it
so
falls in
that
2
there,
separate
so that what you're saying is no space between the 2 phases, but that the first phase ends at about the time our budget cycle shifts.
Right.
Yeah, that can happen. The models were just to show you if you
Throwing
did
a lot of things
take a
for us
gap.
all to think about,
Yeah.
right?
And there are efficiencies to do it that way. You know, there'll be code upgrades for the fire alarm systems and those kind of things from what was originally done, and it makes it easier to do.
Right. Well, obviously, I think we're going to need something in writing from Larry so we really understand what we're talking about prior to this coming back to us. I think the overall plan is a very good plan. It's a beautiful building. And like I said before, I think there's a little fluff in there that needs to go away, and we can talk about that as we go along. The chief knew I was going to say that, so, and I'm sure everybody else up here knew I was going to say it. But I think that the building definitely needs some renovation done to it. I don't know if we need to do as extensively as it's presented. The roof has got to be replaced regardless of what we do. There's no ifs, ands, or buts. And the HAB has got to be looked at. We can't continue burning them up in the summer and freezing them to death in the winter. It's got to be fixed. Yeah, right. That too.
As a follow-up on that, do we have funds already accrued, though? So that would be for the roof and for HVAC replacement?
Well,
So
there's,
that,
What is our main?
yeah,
we
there's
really
some
wouldn't be-
funds for repairing the roof, but not for doing
Putting
the
it off,
entire
putting it
roof.
on, right.
There's some money, and Dave was gonna take a look at that, exactly how much. And then the question is, when do you phase the full roof, and do you even do the repair, the extensive repairs versus just holding it off on timing? So, again, as Larry and I mentioned, we'll have this discussion fairly quickly, so you'll know, maybe we'll have a timeline by, say, the end of March or April as part of the budget. Discuss that.
Very-
And then we can determine whether to do the repairs, because the starting time might be off a year and a half or even further out, or if it gets advanced a little bit.
Okay.
Okay.
If there's one thing that I want to add on the end of this. First of all, it's great working with the police department. They're terrific people. But they are working and living in a facility that's really 44 years old, not 22. This thing is used, it's used 24/7. And they've gotten every bit of life out of this building that they can. And the one thing that we're going to witness, whether we like it or not, is these systems are going to continue to fail, and they're going to start to fail at a more rapid rate. So we just need to pay attention to those things and make the decisions that we can make and move forward. Oh, and to properly address when we finally get down to what this project really is, a recommendation that we're going to make is to delineate the entire project at once. You can build what needs to be built at one time, but delineate it all at once so that it's a very cohesive, tight, complete set. And that's just a recommendation that we're going to make. Thanks for your time.
Thank you. Any other comments or questions from board? Staff, anything? Chief, anything you want to add?
No, I just wanted to say that, obviously there was no intention to have the board make any type of decision tonight. We've been working on this for 6-7 months. This is the first time you've seen it. I would expect that you'd have a lot of questions over the next couple of months. And what I would like to do is contact each one of you individually and offer you the opportunity to come through the building. It's difficult to see a photograph up there and look at a piece of paper trying to figure out what's going where and how it's going to work. Offer you the opportunity to come walk through the building, and we can point out with the map in hand what we're actually contemplating doing and changing, what's going to go, what's going to stay, and how it's going to be moved, and how the building will lay out. I think it'll make more sense to you, whatever you want to, whatever your decision is.
Well, and as Trustee Williams pointed out, the details.
Exactly.
Details.
And I tend to think that the photo, that the renderings that were shown to you today probably look a little bit different than what the actual finished product is going to be.
Oh, I'm sure.
When I saw those, I was like mesmerized. They look like photographs. I expected to see people come walking through. I don't know that it's actually going to look that same way, so.
But at the same time, I could interject into exactly where he was walking. What was over there. Okay, that was dispatched.
And that's what I'd like to do when we walk through.
Records, it was right.
Yeah.
Right.
Because there are some landmarks on the blueprints where you can see certain walls that can't be moved, and then you can see how those fit into the layout and how they've worked them in. It's very nice. So I will probably be contacting each of you in the next couple of weeks to give you the opportunity, if you'd like, to come walk through the building with us.
Just remember, there's never been any love lost between me and that building. I hate it.
No, and I also think that one of the things that we discussed was staining the brick so that we have the darker brown, because there's nothing more distasteful
Yeah, very good.
than that the building the way it looks, and it would change out the aqua color, and we'd make the bricks match the bricks or as closely as possible to the 740 building, so it would look like a unified campus as opposed to a really nice building and then something else.
It's never fit.
Thank you.
Okay.
Thank you. Well, hello there.
Right.
And then after you visit it, you can visit Larry. And so,
Maybe we should visit Larry
we don't want you to be
first.
mesmerized
Maybe
by
we should
visiting the
visit
police
Larry
department.
first.
Would anyone mind if we take a moment or two before we move into this next?
As long as we don't take
Project.
too long.
No, just a
Very important
moment
meeting
or
in the
two.
morning.
Okay,
Make it fast.
all right. We'll take this a moment. Bring us back to order here.
Free, but I'm already, are you at Center? I mean,
Did he pay? I knew he was
What?
going
Yes.
to the police. I knew he
Yeah, that'd be great. Appreciate it.
was. He paid a lot.
I think they're waiting on you.
that's the nice,
He was only here for the police. Yeah.
You don't have much snow
No.
Okay. Next item on the agenda here is consideration of a report and recommendations from the Planning and Zoning Commission regarding a 32-acre mixed-use development located on US Route 45, property formerly known as Kelly's Day Camp and Lycum.
It's hard to say, huh?
Yeah.
Probably.
Thank you, Mr. President. Tonight you're going to be talking about two items. First, as you indicated, the report and recommendation from the Planning and Zoning Commission, who looked at 6 items for consideration that are delineated in your packet. You're also going to be asked to consider possible variations from the building code requirements, and Building Commissioner Atkinson will review those for you as a part of this discussion. You've seen this project a number of times and are, I would think, quite familiar with it. The Plan Commission finally went to public hearing with regards to this on December 19th. to consider, as I said, 6 items. The approval of the zoning, to amend the zoning classification to rezone the property from OR&D to R7 and PUD and B1. The second was to consider a special use permit for a planned unit development to allow a mixed-use development consisting of multifamily residential and commercial buildings, along with certain variations, including but not limited to building height, setbacks, and parking requirements. We'll come back to parking in a minute. Third was approval of a certain special use permit for commercial lot to allow a restaurant with drive-through and bank and a drive-through facility for commercial property. I would note that the Plan Commission, through its deliberation and in conversation with the petitioner, agreed not to consider this, and this would come back for a special use before the Planning and Zoning Commission and ultimately before this body, if in fact a use that required such an item were ever found for that property. So that number 3 in your packet was not acted upon by the Commission due to mutual agreement with the petitioner. Fourth was preliminary site and landscaping approvals. The fifth item was preliminary approval of the architectural elevations, and 6th was preliminary approval of the plat of subdivision. Again, as you know, this is a 304-unit luxury rental community on a 30-acre parcel. There's a total of 8 3-story apartment buildings and 9 row home buildings. Total of 747 parking spaces, including single and tandem spaces, with a parking ratio of 2.46 spaces per unit. You'll also note that, as set forth in the conditions, that the road and parking lots will be privately owned and maintained throughout the project itself. From the site plan, you'll see that there are 5 pods that are created. Pods A, B, D, and E are residential pods of various types, and then pod C contains the clubhouse and related outdoor improvements for the property. And then there's an additional 2-acre commercial lot at the entrance to the development, which contains basically the balance of the Lycum Tap property. As you will recall in the previous consideration of the Hamilton Partners Plan, that 2-acre parcel was also Zone B1 at the time. So the requested zoning on the property is consistent with what was previously approved. As you will note, the petitioner has been working very diligently to obtain property to the east of their site, known as the Glick-Rissman property, that would allow for the eastern access. And they were able to testify at the meeting that they have in fact have a contract to acquire this property and to provide this eastern access, which I think went a long way to addressing some of the concerns about access out onto Route 45 as it currently exists today. And they'll discuss this as a part of their presentation. The commission reviewed the petition and overall was supportive of the request. They felt that the overall site plan and building designs were appropriate for the property. This is preliminary consideration, so there's a number of details that still need to be provided, including signage, lighting, landscaping, final landscaping, and the like that will be considered through the technical review process and then ultimately forwarded back to the commission for final consideration. I would also note that there were notices sent out to the surrounding property owners. We had 2 residents appear at the meeting. One resident who lived in Sanctuary Point spoke, asked several questions about the project, and also expressed concerns about the impact of construction on the adjacent properties. So with that, the Plan Commission took 5 actions with regards to this. With regards to the rezoning of the property, the Commission unanimously voted 6-0 to recommend approval of the rezoning, subject to the conditions of approval that are listed in your packet, along with the related variations, which we'll come back to as a separate action, and then the 33 additional conditions that were placed on this project. I would note that the variations are primarily setback in nature, either between buildings or off a property line, and then the other is variation from the minimum sizes for the dwelling units, which are required by the zoning ordinance. And there is a chart in your packet that identifies those proposed unit sizes. The 33 conditions themselves are fairly straightforward. We'll need to look at the declarations for the property, and we'll review those prior to any consideration of final approval. There's a tree preservation plan that'll have to be developed as a part of the landscape plan that we'll be working with them on. As you recall, there's about an acre-and-a-half area right at the entrance that's being preserved. There's some old-growth hardwood trees in there, heritage and specimen trees that are in there that are being preserved. As previously noted, the roads and parking lot throughout the property will be privately owned, and that these roads and drive aisles within the parking lots will be constructed to public road standards as set forth in the development ordinance. They're aware of that. We'll be working with them to obtain emergency access connection through the ZF Industries property to the north. The Route 45 frontage along the entire property will be built to an urban cross-section as defined by IDOT standards, which basically means there's going to be curb and gutter along that portion of the road, along their frontage. There's an existing bike path that runs along Route 45. This is kind of like the hole in the donut for that section, and they will be constructing the bike path that will connect the two pieces along there, which is a great thing. As you recall, we had several residents a few years ago asked for that to be done. Second action was with regards to the special use permit for the plan unit development to allow a mixed-use development consisting of multifamily residential and commercial buildings along with the variations as previously listed. The commission voted unanimously 6-0 to recommend approval of the special use permit. The third action was a unanimous recommendation for preliminary site and landscaping plan approvals, subject to, again, the conditions in the packet. Fourth was unanimously recommended approval for, or preliminary approval of the architectural elevations being Scheme D, the color palettes for the row homes, apartments, and the clubhouse, and then the additional condition there of that shutters would be added to the rear elevations for the row homes, again, subject to the conditions set forth above. You see the samples here before you. This is not representative of the construction quality that will be applied to it, but these are the items as you see. And then the final action was unanimous recommendation for preliminary approval of the plat of subdivision with the condition that the right-in, right-out would be removed from the plan. That is now possible with the eastern access that's been proposed by the petitioner. If the committee feels that the request is appropriate, it's recommended that the staff prepare the following ordinances. And the primary difference here, I will note, is the timing of these ordinances. The first is the ordinance granting preliminary approvals to the plat of subdivisions, site and landscaping plans, and architectural elevations subject to the compliance with the conditions set forth in the plan. And you would be asked to consider this at your next meeting on January 22nd. Number two would be preparation of the necessary ordinance granting the requested amendment to the zoning classification to rezone the property, subject to the conditions set forth in your report. This ordinance would be presented at the time for consideration by the board when final approval is considered for this project. So we would not be rezoning this property until we get to final approval, if you so choose. And then the third would be preparation of the necessary ordinance granting approval of the special use permit for the actual PUD itself, again, subject to the conditions set forth in your packet. That would include the variations, and that this ordinance would also be presented to the board at the time of consideration for final approval for the development. So you will not take if you so choose to move this forward and recommend and direct us to prepare the ordinances, you'll see one ordinance at the next meeting that will be for site, landscaping, architecture, and preliminary approval of the plat of subdivision. And then when we go to final approval, you'll see two other additional ordinances that will be for rezoning of the property and for the special use permit granting the PUD. So those are the actions coming away from the Planning and Zoning Commission. Mike can review the building code variations for you when you're ready, or we can do it now, however you want. And then the petitioner is here tonight, can walk through the presentation with you as you so choose, can answer any questions with regards to both the architecture, the site, the landscaping, traffic questions, engineering, whatever you need, they can answer the questions for that.
What's the board's pleasure? Do we want to do A and B together? Go ahead and go through the building codes?
I'd like to go through the building codes.
Okay, we'll go ahead and go through B then, and then come back and do it all together.
Okay, thank you. I can review the variations then for you from the building code. In connection with the multifamily building, there'll be 3 variations that are requested. In connection with the row homes, there'll be 1 variation from the building code that's requested. First off, for the building, for the multifamily buildings, item number 1, the building code requires that buildings that are greater than 2-story cannot be constructed of type 5 construction. Type 5 construction uses materials that are combustible. What the developer is requesting is a variation to allow the type 5 construction conditioned upon the following alternative method. Number 1, they would construct it as a type 5A building. Type 5 has 2 subparts, A and B. A requires a 1-hour fire rating of certain structural elements. B does not. So they would design it as a 5A, which is the higher level of type 5 construction. Additionally, they would sprinkler the building in accordance with NFPA 13 rather than NFPA 13R. And what this means is certain elements within the dwelling units themselves, the bathrooms, the closets, which would otherwise not need to be sprinklered, would be sprinklered. And then most importantly, the attic would be sprinklered. They put a dry system up there, so if the sprinkler system actuated, it would go off within the attic area that has exposed combustible elements. This is the alternative.
Just a quick question on that. So we're talking about lowering the materials, but increasing the stringent, a slightly more stringent sprinklering system, is that?
Yeah, that's correct. Basically, it's a variation that would allow combustible structural elements rather than non-combustible structural elements. And then in return, they're agreeing to increase the sprinkler coverage within the buildings.
Has any of this gone through the fire department?
That
Has the
would be-
fire department reviewed any of that?
Yeah, we've had numerous discussions with the developer. We've also met with the fire protection district, and all the variations that are before you tonight have been reviewed with Lincolnshire Riverwoods Fire Protection District, and they have voiced their approval in those meetings, or at the very least, I should say, did not voice an objection to these variations that are being requested.
So did they approve it?
I was going to say, there's a difference between not objecting and approving.
We were all in agreement in those meetings that these alternative methods, we felt met the intent of the building code.
So when it went through technical with them, they approved it.
That's correct.
Okay.
Thank you.
So that would be variation number 1, to allow type 5 buildings. Now, when I say variation, in this case, it's a variation from an amendment to the building code. As far as the national codes go, they would be in full compliance with it. The national codes would allow a type 5 building that's this size and this height. It's just that our amendment, our local amendment, wouldn't allow a type 5 construction for buildings that are greater than 2 stories. So variation number 1 would be to allow type 5 construction for a building that's greater than 2 stories with the alternative methods that I just outlined for you. The second variation that's being requested has to do with separation assemblies between the dwelling units. As the board is aware, and our amendment to the building code requires that masonry or similar non-combustible materials be used as part of the separation assembly between dwelling units. The developer is requesting a variation from this section, and the alternative method that they would use would be similar to that was used in Port Clinton Place townhomes and Aspen Point as well. They would use the assembly would consist of 2 walls constructed of 2x4 members. The studs would be staggered, and then the ancillary space would be filled with a fire retardant and material that also has a high sound attenuation rating as well. That would maintain a 2-hour fire rating, which would comply with our local amendments and would exceed the 1-hour fire separation requirement of the national code. So they've agreed to that alternative method that would allow combustible elements in the separation wall assemblies between the dwelling units. And finally, the third variation has to do with the floor ceiling separation assemblies between the dwelling units. Similar to that of walls, our building code requires that non-combustible materials be used. So that typically is reinforced concrete that's used between the dwelling units for floor ceiling. The developer is requesting a variation from this that would allow for combustible elements in that assembly. As part of their alternative method, they've agreed again to maintain the 2-hour fire rating. And this assembly would be as such, going from the top, there would be a level crete, which is a gypcrete material that would be poured over the subflooring. Under that would be a sound attenuation board, and that would be in the area of where hard surfaces are, like the foyer, kitchen, bathroom. Under that would be the 3/4 inch tongue and groove plywood. Then there would be wood trusses, and then continuing down, attached to the bottom of the wood trusses would be 5/8 Type X gyp board. And then attached to that, running perpendicular to the trusses, would be a resilient channel. And then 2 more layers of 5/8 gyp board would be attached to the bottom of the channel. And the cavity spaces, similar to the wall, would be filled with a fire-resistant material. In both cases, and I skipped this with the wall, but in the case of the wall and the floor, the sound attenuation rating would be greater than what is required by the code. In the case of the wall, the sound attenuation would be 53 rather than 50, and in the case of the floor, the sound attenuation would be 52 rather than 50. And then finally, with the floor, what they're going to do is they're going to stiffen the floor so that it's above the minimum requirements for deflection. And what that'll do is it'll help mitigate impact sounds from the dwelling unit above. You know, if it's a bouncy floor, obviously you're gonna hear that impact noise. If it's a stiffened floor, it'll help minimize that kind of sound. And so that's the method that the developer has agreed to in connection with getting a variation to use combustible elements in the floor ceiling separation assembly. In all 3 of these cases, again, there was numerous meetings between village staff, the developer. Those meetings included the Lincolnshire Riverwoods Fire Protection District, and the end result is what I've reviewed for you tonight. And if the board did agree with these variations, it's my recommendation that all of these conditions be included as part of the conditions. So that's for multifamily buildings. For the row homes, our building code, and row homes are side-by-side units. They each have their own entrance and exit. There's no common elements to the building. So our building code simply requires a masonry separation unit wall between the dwelling units. They're asking for a variation from this requirement to construct the wall similar to what I explained for the multifamily building. It would be 2 2x4 framed walls, in the ancillary space being filled with fire-rated insulation. So those are the variations for you. I can answer any questions that you might have. The developer is also here and he can review any of those as well for you.
Okay, questions from the board?
I'm trying to absorb everything he said.
Yeah, I know. Well,
Whose head is spinning?
and a lot of this is stuff we've been over a number of times.
I know, but now if push comes to shove.
I guess the one question I got is, can you make a direct comparison? You said Port Clinton and Aspen. Well, Aspen's a condominium. So the Port Clinton, you're talking about the Opus Tower?
The row homes.
Oh,
The
the row.
comparison I was making was and I probably wasn't clear enough. I was comparing the row homes for the Oaks
Okay.
to the townhomes at Port Clinton and the row homes at Aspen Point, not the tower.
Okay. But they're looking for the multifamily to be of the row home construction model as opposed to the construction model that we're looking at for the Opus Tower that's in place.
That's correct.
And the apartment complex, or the apartment building in place that, in the town center.
Yeah, that's correct. The approval for those developments allowed for deviations from the building code that would have allowed combustible separation between those dwelling units. But in both cases, the developer chose to go with masonry or non-combustible separation. So both the Opus building and the town center building have masonry separation wall and floor ceiling assemblies.
And Amley also has masonry.
That's correct.
I'm a little bit concerned. I mean, as everybody knows, I live in the town center building. I hear nothing, absolutely nothing. And I'll be honest, I was quite excited about you guys building a room. I mean, it's quieter than the highway, but it bothers me. I'm sorry. I was saying that I was quite excited about your project for not only myself, but other people in town looking for a quieter neighborhood, if you would. And I'm a little concerned about some of the deviations. I mean, I realize they're not life-threatening, apparently, but it bothers me that a beautiful project is somewhat being cheapened.
That's, that's a
And I don't like
legitimate
that.
point. What we did in asking them to increase the STC rating above what the minimum requirements of the building code was to match what an 8-inch CMU or masonry unit would be, which is a 52 rating. The building code would require a 45 STC rating. We asked them to increase
Speak English to me.
the way to measure sound transmission.
Thank you. But you're still gonna
STC is sound
hear.
transmission
You're gonna have to
class.
give.
Yeah, the higher the number, the better.
Yeah, the higher
So,
number, but
I
this is
understand
actually
that.
higher than,
so the higher the number,
So we're not gonna hear, and I'm not gonna have a giving.
no.
right.
Let him answer that, not you. Go ahead.
Okay, so in the case of the walls, what we did was the STC, or the sound transmission rating,
Right,
for an 8-inch concrete block is 52.
got
So
it.
even though they're using combustible materials, we asked them to use a design that would result in the STC rating for the walls to be 52 or higher, and they reached 53
For the walls, side to
for
side.
the walls, right?
What about top to bottom?
For the floor ceiling, they got to 52. So it's not quite as 53. And in addition to that, we asked that the floor be stiffened because there's noise that you hear from people talking, and there's also the impact noise from people walking on the floor and the structure vibrating. That's why we asked that they stiffen the floor, they lessen the deflection on the structural design of the floor,
Okay.
which increases the stiffness, which helps minimize sound impact. And we did that with the idea that we would have a structure that I can't say will be equally as quiet as concrete, because concrete would be a little bit quieter, but would be something in line with that. You're still gonna you're still gonna hear someone walk above you. You're gonna hear the structure move a little, much more so than you would with concrete. But what they have designed is something much greater than what the minimum code would require.
Somebody said if I hear the concrete moving, I got a problem. I agree.
Does the levelcrete go below the walls, or is it poured between the erected parting walls?
You're gonna pour it between the walls, or are you gonna pour it and then put the walls on top?
In other words, will you put it on the deck before
Yeah.
you erect?
Well, that's the answer I wanted to hear, because he said they're gonna pour it after they put the partitions up.
Okay.
And what I like about this then is it also acts as a really good fire stop. So what we'll do is, if they're going to use that method, is we'll ask that they pour it after they run all their mechanicals. So all the electrical piping and plumbing and all that will be more effectively fire stopped using this kind of material.
How thick?
It'll vary between 3/4 of an inch and 1 1/4 inches. It'll be thicker in the areas where there's carpet, and it'll be thinner in the hard surface areas because underneath that, they're going to put a sound attenuation board.
Well, I'm a tad concerned, what do the numbers then mean if you're achieving a higher quiet rating and you're saying it might make more sound? That doesn't make any sense to me.
Well, yeah, the sound, yeah, I understand.
Because I thought STC ratings were, and the fact that you've got and the fact that in the floor, you went with an L360, which is twice the L180 rating that the other, it would sound to me that if the numbers are higher, that's supposed to mean it's quieter, correct?
Yeah, that's correct. There's two types of sound. The sound that you're going to hear someone talking.
Okay.
That's the STC rating that I'm referring to.
Okay.
Then there's an impact noise, and that's someone walking across the floor. You're hearing the structure react under loading. You're hearing the floor bounce, the structure itself move. That's an impact sound. So for the sound transmission, the hearing people talking thing, we've asked them to increase it, in case of the floor ceiling, from 45 to 50. For the sound impact noise, we've asked them to decrease the deflection to stiffen up the floor so you don't hear the structure moving as you walk
What
across.
about with relation to something which is now becoming extremely common, a subwoofer attached to some kind of a home entertainment center?
Oh, my God.
Those generally sit on the floor, and the whole point of a subwoofer is that it's vibration as well as
You're going to hear
actual
that.
sound.
You're going to hear that because for that kind of equipment, we'd have to get an STC something above 60, which is incredibly difficult to achieve. And then I'm not even sure how much that sound would vibrate through the floor and have the same kind of sound that an impact sound would have. So to answer your question, you're going to hear that. You're going to hear that.
That's
Yeah,
the whole idea of the resilient channel, is to reduce the transmission of the vibrations. So
Absolutely.
there's no rock sol though between the floor joists.
Pardon me, there's no...
Rock sol, rock wool, whatever you want to call it.
Oh, there is
sound.
there is a fire resistive sound attenuating insulating material in the cavity spaces of the
Between the
roof
walls.
of the yeah, between the walls, and then also within the cavity spaces of the floor ceiling.
Oh, so between the floor joists there will be rock sol or...
That's correct.
I think I know.
What is the factor of and compared to a poured concrete floor versus this, I know in structure-wise, you have the sound deadening, but it's also a firmer base, which doesn't give you, concrete won't give you the flex as wood. And that's one of my comments, because I know I've been in places with a poured concrete floor, you may hear something occasionally, but it's very seldom, and you don't get the creak.
If I could elaborate on what Mike has said, first thing I'd like to note is that each of the floor and ceiling assemblies that we are proposing for use have all been tested by UL and approved. So those fire ratings, the 2-hour fire separation, that's all, all that is the one thing I want to add regarding that. With respect to the sound attenuation, these assemblies, and look, I've been in the business for 25 years, and built thousands of for-sale, high-end, multifamily units, side to side, top to bottom, so I've got a lot of experience in this area and have spent a lot of time working on these assemblies. The assembly that Mike referenced, the wall-to-wall with the new wool insulation between, I'm almost sorry now that I didn't bring my my demonstration here because I was very skeptical when I first saw this product. It's been around for many, many years with a new twist, and that's the borate treatment that provides the outstanding fire retardancy. It's also an insecticide, fungicide, so the stuff never goes away, never loses its properties, and it doesn't go away under heat. It's a terrific insulator. It's not as good as some of the polyisocyanurate, the foam insulations, but the problem with the foam, put them under heat, they melt, you got a cavity now that'll conduct a fire. This stuff doesn't burn. I've literally myself taken a handful of the insulation and a copper penny and a blowtorch and melted the penny, never felt the heat, and it never went through. The stuff turns black, doesn't burn. So the reason why you get a 2-hour sound or 2-hour rating out of it is because the staggered studs, the fire burns through the drywall, that takes an hour. The drywall falls away, that first wall is gone, but that insulation stays there, and it doesn't transmit the heat to the staggered stud on the other side. That's the second hour, so that's how it does it. But that cavity is full of this stuff. The other demonstrations, you take a 5-gallon ice cream bucket, the cavity, pull the pin on a personal alarm, drop it in there, you can hardly hear it. I've used this in my own home, used it in high-end custom homes, used it in many multifamily applications because it's so darn good, because it does those two things. It provides terrific fire separation. You can even get a 3-hour structural wall out of this stuff with frame construction because it's so good. And we're proposing a 2-hour, which is twice what the code would otherwise require, but it meets the Vernon Hills amendment, which is 2-hour fire separation. So just back to the sound attenuation properties are phenomenal. Now we'll go to the floor ceiling assembly. There are, in fact, two recognized tests. One is STC, which Mike had referenced, sound transmission class. That's the airborne. The other is IIC, or impact insulation class. That's somebody doing that. Concrete's terrible for impact. So, I mean, if you don't have something like carpet and pad on top of concrete, you hear that through the concrete, or you drop a ceiling below the concrete to get to isolate that mechanical sound transmission. And then what Mike was describing, the low frequency of the structure moving. L over 180, L over 360, we went to a 20-inch deep floor truss. The deeper the truss, the stiffer it is. So we're looking to create really, if we can get to L over 480, L over 540, obviously it's a function of the top chord, bottom chord. You've got 3 layers of drywall on the bottom of that. That is also going to dampen it. The differentiation of materials from the levelcrete, which is much improved over the old gypcrete product. It's 2,500 PSI strength, so it's a very hard surface. Difference between it and lightweight concrete, it expands when it cures. So to the earlier point, it's great at filling gaps, whereas lightweight concrete shrinks and you are left with these little gaps. And you've got to be absolutely sure that you fill all those little gaps, both for fire and sound. And we'd used acoustical caulking, obviously fire caulking in any of the penetrations. So we're very attuned to that. I've been down this road in high-end for-sale product using similar construction techniques. I don't think I've ever used 3 layers of drywall, because typically we're not looking for 2 hours floor to ceiling. So 3 layers of drywall is obviously going to add to the sound attenuation properties. So very, talked with USG, talked with Shiner Acoustics, talked with another acoustical expert, talked with Newell, again, had multiple conversations and meetings with Mike and the fire department. I'm very convinced that we're building a very sound structure that will both perform and meet the acoustical expectations.
Anything close to here that's built with this that could be maybe looked at, or?
Well, floor to ceiling assembly, or
either.
wall to wall. Wall to wall. Port Clinton Place is the same wall assembly.
Okay.
Same unit separation wall. That one is.
How about the floor to
very easy.
ceiling?
Floor to ceiling, as I said, I've done a similar, the UL assembly we're recommending here is L577. It differs from L521 in that L521 has the same sound attenuating topping, subfloor, open web floor truss, RC channel, and then one layer drywall. That's a 1 hour separation. We've done that a lot. The difference between that and this is now we've got a layer of drywall in the bottom cord, then an RC channel, then 2 more layers of drywall. So I've not done that assembly before because frankly 2 hour separation in sprinklered structures is uncommon. But it's the approach that we want to take here. So I'm happy to provide more information, show you, I don't know if it's beneficial. I don't think you're going to be able to see anything.
Well, the sound is one of the big things because nothing can make for a more combative neighbor situation than sound problems.
The other thing to note is that we control the flooring surfaces because it's a rental, and the preponderance of the living areas, bedrooms, living areas, be carpeted, and that right there, you get up well into the 60s in sound transmission class, and with the pad, with the decent pad, the impact noise goes away. So you have limited areas in the bathrooms and in the kitchens with the hard surface flooring. So we're immediately minimizing that type of issue.
Any other comments, questions from the board or staff?
I do like the project.
Yes. And I had a question about have we talked much about the additional access?
Well, it was considered by the Plan Commission. I think the commission was very enthusiastic, to say the least, about having that secondary or that eastern access. It provides a great alternative for residents who live there to leave the project, especially at AM peak periods, which may be a challenge to get out of, especially making a left turn. So from that standpoint, like I said, I think the commission was very enthusiastic about what that offered. I mean, there's still some work to do with it. Obviously, for one thing, just so you're aware, that property, the Glick-Rissman property, was outside of the PUD considerations, and the petitioner's aware of that. So we'll, with any kind of future use of that property other than what was permitted within the Corporate Woods Park, they'll come back before the commission and you all at some point in the future. There's still some additional reviews in terms of the traffic impact that may be generated by exiting this site and going in to the park itself, and especially going northward to Woodlands Parkway and then ultimately to the intersection of Woodland and Milwaukee. What traffic impact may be for having additional residents from this development using that intersection and either going left and northbound or right and going southbound onto Milwaukee, especially in the morning. So there's some additional review that needs to be done with regards to that.
Well, is that something we would know significantly more about before we ever get to any real finalized type?
Yes, absolutely.
Because first of all, I want to tell you that I appreciate the effort you guys have put into going ahead with that part of the project, because that was something we talked about very early on, and I definitely appreciate the extra effort you've put into taking care of that additional access. But I was wondering if that's something that'll be as final as possible before we...
Oh, absolutely, and we would go beyond that point. You have a traffic impact study that's in place, but not completed, and did not anticipate this access point as a part of its review. Dave's worked with their traffic person, and this has to be resolved before final approvals. So
yeah. Dave?
Yeah, I guess in terms of the traffic issues, that was one of the issues that the board had raised earlier, saying before you go to technical review, please provide some traffic information. We did meet with their staff. We have a consultant. We reviewed some initial information. Our consultant has done a review, and there's a review letter outstanding in terms of the traffic issues. Really, it was useful. What some of the things that we were able to derive was, would a traffic signal meet warrants right at the entrance here? If not, would an alternative be Corporate Woods? We looked at that. It would not meet warrants, and in fact, it would cause more problems. You wouldn't have a gap. We also met with IDOT trying to find out, really what would IDOT require in terms of improvements? Would they require the Phase 1 widening from Fairway Drive going easterly or not? Warren and his team were able to derive from IDOT that no, they wouldn't require a full widening at this time. So very good information. Where we are at today is, typically for preliminary approvals, we have a finalized traffic report. And where we're at now is we've talked about the traffic information, them submitting a revised traffic study that includes the recommended connection to the east. I think anecdotally, it really helps the situation because it helps to distribute some more of the traffic instead of right out at the one entrance out to 45. It will distribute it out in a couple of different directions. In terms of how that distribution and to what degree it improves the traffic situation, because we only have, we don't have a widened Route 45 yet. To what degree this will help, that's where this traffic information that we're looking for will help us with those answers. Today, I wouldn't be able to tell you with any certainty to what degree it's improved, et cetera. So the traffic issues are still outstanding.
Can I expound a little bit, or do you
Yeah,
want
sure.
Tim to expound a little bit? I think Dave's right on. There's no question that the eastern access provides a relief route, and it creates a number of alternative paths for people entering and exiting. And it really is going to come down to what assumption you make as to how many people will use that path. And I think, first of all, we got the property under contract in the middle of December, so there wasn't time to respond appropriately, and then doing traffic counts in the middle of holidays wouldn't be appropriate either. So we can go back and do traffic counts. We've already done traffic counts. We'd have to do traffic counts up here at Woodlands and down at Route 45. We've done the gap study. We've analyzed the left turning movement out of the main entrance. What the key assumption is, and I think we're looking to build some consensus from the various traffic engineers, all right, how many people are going to actually come out the eastern access? And if they do, are they going to come down to Woodlands and then take a left? Or are they going to go up to Milwaukee Avenue and take a right? And when they're coming in from the north, well, they could come down Fairway and take a left, or they could come down Milwaukee and take a right. There's all sorts of possibilities. We looked at these different routes and different distances. Anybody who's coming from the east during peak evening rush hour traffic will quickly figure out you can cut off 2,250 feet of backup by taking a right and then coming down Forest Edge and entering through the east access. That's going to be a real relief during the evening westbound rush.
Well, and the traffic numbers, I mean, good accountants can make 2 and 2 equal 3 or 5. A good traffic guy can make it equal anything from 1 to 100. So,
That's why
I've seen them manipulate numbers significantly.
So it really depends upon what the underlying assumptions are. So we're looking for, we can count cars. We've done that. We can go do an intersection capacity study up here at Milwaukee Avenue and Woodland Drive. The reality is there's so many cars coming in and out of there, we're going to have a negligible impact. I think the assumption was that we would be 5% of our traffic, or 10% would be going outbound, 5% coming inbound from that direction. That's a small number. relative to the number of cars that pass through that intersection. Again, looking at the alternative routes, one thing that Tim brought to my attention, I think makes a lot of sense, is making that left turn during the evening rush. Oftentimes, and Tim knows it better than anybody, sorry Tim, because he offices right there. His office is 850 Forest Edge Drive. He's the traffic engineer that makes this turning movement every day. So, you know, Tim's observation is that, yeah, this left turn out can be challenging during the evening rush because you're relying on a courtesy gap if the train's there. Train's there, cars back up. Now, you get further away you get from the tracks, the more gaps there are. Now we have 2 potential left turns. So we've at least doubled, if not more than doubled, because we'll likely have more gaps at Woodland to make that left turn to the southeast movement on 45. And if you're really backed up, you can always go out to the north and make the right turn there. So there's a lot of alternatives, and I think people are going to learn what time of day to use what route.
Mhm. So
I'm happy to go through a
what? No.
pitch.
What are
I'm
we
happy
What are
to
we looking
answer.
for?
Well, I guess the question for the committee is, do you want to grant them preliminary approvals of these items subject to the conditions in your packet?
Well, before we get to that point, I mean, I thought we were going to go back to page 1 and talk about the zoning. In that, we talked about the construction, maybe I misconstrued, but I thought we were going to, because here's my conundrum. I'm sold on the construction techniques that you're talking about. This location is going to become a enclave, for lack of a better term in my vocabulary. It's going to be unto itself, and it's kind of like a club environment or whatever, in that you've provided a very nice clubhouse, and the way it's landscaped, you're maintaining the heritage trees, all these things. It's a real nice enclave. Where I've got my problem is then, because it's an enclave, it should be a higher end kind of locale in a sense, even more so than Amley, okay? And Amley, I think, considers itself relatively higher end. But when I look at the 1-bedroom apartments, I see extremely small and way, way, way below our current code. And that's where I'm having the problem. I'm all in favor of utilizing space effectively. And if it was me, by myself, I could see myself in there. But most people aren't like me. I've got a little bit of OCD, so I keep things dress right dress. The dishes get stacked away, et cetera, et cetera. There's no clutter. And yet these apartments are relatively small for an enclave. And that's kind of the discussion that I really wanted to get into at this juncture before we got to looking at voting or anything of that nature.
A trailer.
I'm not sure if that was directed to me or to the other.
Well, it's directed to the board president right now to decide if he wants to entertain additional or how he wants to pursue.
50 or 670, and you take a trailer that's 12 feet by 6
Well,
feet. That's 7 feet.
some of that goes to what we talked about before with the numbers. When you go to the smaller unit, it's going to be a less population for potentially more. You know, you wind up with more units per acre, but potentially less people, because you're probably talking about a single person in a 1-bedroom like that that's 700 or at for sure empty nesters, because you're not, you know, bringing in a kid to a space that size. Yeah, yeah.
I wouldn't
So there's
guarantee that
a
it's
bit
a
of a,
single.
there's a bit of a trade-off in terms of your numbers, and that would go to which way do we want to go with it? So what, any other board members have any, or staff have any
Well, I mean,
comments on that?
from the Plan Commission's standpoint and consideration, there weren't any issues with regards to the unit sizes. I think there have been a couple of other projects here in town that have had comparable small units like this. But there was no objection raised to the unit sizes that are proposed in either case. I think that there was a recognition that it provides a variety of living units that can serve different populations. The single or the single person, the single with child, or the couple who are maybe downsizing or the like. So the transferees coming in for a corporate stay for a year or 2 years. So there is a variety of sizes that facilitate different types of family units that may occupy this building. So.
And my initial reaction is similar. The votes of the Planning Commission were all 6-0.
Yeah.
And my compliments to the Planning and Zoning Commission. This is extremely detailed and well thought out, well worked through. And your work in working with them, I compliment you as well.
Thank you.
Again, I just go to it. It's just a viewpoint of which
Right.
which
If
way
if you
you
go
want to
to
alter the
page
numbers.
85, though, of the materials we have, it shows the apartments, and while they're extremely functional in their layout, and they're providing, counter space for a certain amount of dining, although the stools aren't shown in the smaller unit, the A1, but the B1 does show the stools, but it also shows a very small table. But I guess what I'm suggesting is just, it's such a long way from our code of, 1,200 square feet down to less than 800, so,
See, a
basically-
normal trailer is a 12 by 60, which is 720,
yeah.
so it gives you an idea, but it's,
And I had a home at one time that was 55 by 11, with my wife in there, and
5 by 11?
I'm sorry, 55 by 11. Yeah, it's a mobile home. I mean, it was in the woods, and that got crowded. Granted, it's roughly 600 square feet, but and this is a little bit larger than that. I guess I'm just
that's why I use the trailer.
yeah, suggesting that, because of the nature of the high quality, really, the high quality of life that is kind of being represented here, that there might be a little more space given to the lower end units.
We are designing to the market, and obviously, we would be foolish to design a unit that didn't appeal to the market that we're addressing. There are many changes, flat screen TVs. You no longer have that monster cabinet.
Right.
You don't have monster speakers. I got them, they're still in my basement, but they're little bitty ones that put out great sound. The stackable washer and dryer in every unit. There's a lot of ways that people have learned to live more efficiently. And frankly, there are 2 small one-bedrooms on the second floor. There's Unit A here and here on the second floor, and there's 2 on the third floor. Those are the smallest. Next to the elevator, next to the lobby is a similar unit, but we've been able to take back the space that sits over the lobby and make it into a den space. So this is a 1-bedroom den with substantially more usable space, and so there are 4 units in each building that with that configuration. Then we get to our bread and butter, which is the B unit, which is everything you want in a one bedroom. Functions very well. Go back to the A for a second. That A has a very big kitchen. So it's substantial. You can cook, you can live in there, and yeah, you're gonna have a couch and a chair, but these are people who are renting, whether they be here for a year or 10 years, they're renting because it suits their lifestyle needs. Same with the B, it has a little more space, and then you can see, if I go down to the first floor, I think I pulled out the first floor. The D unit is a lot like the C on the first floor. The D unit has split 2 bedrooms. On the first floor, this bedroom goes away, but otherwise you've got a very substantial 1-bedroom plan here in the C. And obviously the E is the premier 2-bedroom unit in the rear corner. When you evaluate the site plan, these buildings have been positioned in such a way that the more desirable, larger units have the better views. So again, we're trying to meet the market both in terms of living space and economics.
And we've actually had, I think Aspen Point, am I correct, ended up in their siding, couldn't fit a king-size bed in their bedroom. It would not fit, the bed would fit, but you would not be able to have a nightstand or anything, so they had to redo the structure.
Here's a typical B unit plan. I can't read the dimensions here, but I think those are 11 by 12, 11 by 13 bedroom size, which is plenty. And you can see that they're putting in a, if not a king, a queen size bed. I think that is a king width on that.
I don't know the dimensions.
Could be a king-size pillow or a queen-size
Yeah.
But it's very nice.
They've all been designed in such a way to accommodate a king-size bed. The secondary bedrooms may not accommodate,
Yeah,
but
that-
you wouldn't expect that.
No.
That's a typical 1-bedroom, and here's a typical split 2-bedroom. But even this, it's almost a dual master suite. You can see here, this would accommodate a roommate situation or a parent with child. I think I read recently that they're experimenting with like 300 square foot units.
Oh, yeah,
I mean, it's
there's micro units out there.
step outside to change your mind.
Yeah.
Yeah.
What does Japan do?
Well, yeah, that's the thing I saw in Japan, that where all the storage is in the floor and the ceiling.
We haven't quite reached that point.
All your floor panels slide like a puzzle so that you can do all your storage. The same thing with the ceiling.
Wow.
Yeah. All right, so do you want that separate, or do you want to just
No,
go on each of the
If
total of
it's the
5?
pleasure of the board that they're comfortable with that, and I'm the only one that has the slight amount of trepidation, I can be bowled over.
Mine's the same,
I
I'm
know
sort of
where you're
slight too,
coming
so.
from, but at the same time,
Mhm.
I can understand a single
Yeah.
person.
Yeah.
You know,
It's a
we
changing
have a
market.
lot of
It is a nominal number of units out of the whole, so.
on weekends or whatever. and,
Yeah.
You know, it's perfect for them. We have more than several, I'm sure, corporate apartments in there that people are flying in and staying a week or two and leaving, and they're just there for a while. So I do think there is a need for all the items that you're offering. Like I said.
I did have one other question, and it's just kind of an off-the-wall. There was an article, I guess, in Cranes recently about the fact that some developers are now starting to build condos. The rental market's not as, just any commentary you'd like to make?
Not this developer. No, I think we've got a ways to go. There, be very serious about it. I think everybody recognizes that the for-sale market was hyper-stimulated. We went from 55% back in the 50s rent ownership, all the way up peaking over 70% ownership. That obviously was too high. That number's coming back down 67, 66. We might get back to 62 before we reach some equilibrium. I don't think people have given up on the dream, but they recognize that, hey, you know what? Jobs unstable. We need rental housing. It's the right thing. And if you're not seeing substantial increases in property values, you got to be in a house at least 5 years to recover your transaction costs. And between the taxes and you understand, Mike, you're in the business. So I think people are coming back to a different understanding of what is appropriate housing. And finally, people are not necessarily looking at housing as the best investment. It's still a good investment, but there are other avenues to put your money where they can earn a higher rate of return than plowing all that capital into a single-family home.
So John, exactly how many motions are you looking for here?
Well, I think there would be 4.
Okay.
3 related to the Planning and Zoning Commission, and the 4th one would be related to the building code variations.
Okay.
I think, as I noted on my report, we would be talking about preparing. The first motion would be to direct the staff to prepare the necessary ordinance granting preliminary approval to the plat of subdivision, site and landscaping plans, and architectural elevations subject to compliance with the conditions set forth in the report.
Okay.
And
Let's do them one at a time.
Yep.
Okay? Is there a motion to that extent?
So moved.
Second.
Okay, motion is second. Any other comments or questions?
And I would note it as a part of that item 5 in here, going back to Dave's comment, requires the petitioner provide updates and amendments to the traffic study. So we'll,
I agree with that.
we'll send something back to you at some point when Dave has worked through the required information. So,
First and second.
so that's
Yes.
just, I just wanted to note that.
Okay.
So.
And that
Right.
was Williams and Schultz?
Yes. Okay. Hearing no other comments or questions, a roll call on that one.
Trustees Schultz,
Aye.
Schwartz,
Aye.
Williams,
Aye.
Hebda,
Aye.
Cook,
Aye.
Markwart.
Aye.
Motion carries.
Thank you. The second motion would be to direct the staff to prepare the necessary ordinance granting approval to amend the zoning classification from OR&D Research and Development, Office Research and Development, to R7 Multifamily Residential PUD, lots 2 and 3, outlots A and B, and B1 General Business for property, or for the property being Lot 1 and outlot C, subject again to the conditions as set forth in your report. This ordinance would be presented at the time of consideration for final approval.
Is there a motion to that extent?
Motion to approve.
Second.
Motion is second. Any other comments or questions?
That was
Here.
Trustee Hebda, second?
Yes.
I did.
No, no,
Or-
Barbie.
Well, I'm sorry.
Okay, hearing no other comments or questions, a roll call, please.
Trustees Schwartz,
Aye.
Williams,
Aye.
Hebda,
Aye.
Cook,
Aye.
Markwart,
Aye.
Schultz.
Aye.
Motion carries.
And then the third would be to direct the staff to prepare the necessary ordinance granting approval of a special use permit for a planned unit development to allow development of a mixed-use development consisting of multifamily residential and commercial buildings, along with certain variations as listed in your report. That would be including but not limited to lots and unit sizes, building height, setbacks, and parking requirements, subject to the conditions set forth in your packet. Again, this ordinance would be presented to the board at time of consideration of final approval for the development.
Is there a motion to that extent?
So made.
Second.
Okay, motion and a second. Any additional comments or questions? Hearing none, roll call, please.
Trustees Hebda,
Aye.
Cook,
Aye.
Markwart,
Aye.
Schultz,
Aye.
Schwartz,
Aye.
Williams.
Aye.
And then the fourth would be for Mike.
The fourth one would be approving variations from the building code for the multifamily building, 3 variations, one pertaining to type of construction, allowing type 5, one pertaining to dwelling unit wall separation assemblies, allowing combustible elements, and the third one pertaining to floor ceiling dwelling unit separation assemblies, allowing combustible units. The approval is conditioned upon the developer following the alternative methods that were outlined in tonight's meeting and also specified in your report. And then one variation for the row homes pertaining to combustible elements being allowed in the wall separation assemblies, again, subject to the conditions outlined in your report.
Okay, is there a motion to that extent?
So made.
Second.
Motion is second. Any other comments or questions? Hearing none, roll call, please.
Trustees Cook,
Aye?
Markwart,
Aye.
Schultz,
Aye.
Schwartz,
Aye.
Williams,
Aye.
Hebda.
Aye.
Okay, motion carries. All four of them carry. So,
Thank you. You will see one ordinance come back at your next meeting, and then at some point in the future, you'll be back for final approvals at some point in the future.
Just a quick question too, price-wise, for a one-bedroom.
$1,275 on the low end to $1,600 for the larger one-bedroom. Thank you very much.
Thank you.
Thank you.
It wasn't quite as painful as you thought it was going to be.
and seriously, thank you for the
I said
extra work you
quite.
put into the additional access and that. It was, you know, you guys have been very receptive to comments.
You
tonight,
have.
So appreciate it.
Good job.
We do appreciate that. Thank you.
Thank you.
And I do think you're going to have a great project.
I know we're going to have a great project.
Yes.
I'm very
Okay.
excited. Thank you very much.
That being all I see on our agenda, it'd be a motion to adjourn, and we are going
that
to
it?
close
Is that it?
session.
Seriously? It's
Yeah.
10 after 10?
I would think there'd be
For
more.
Man.
executive session. Is there a motion to adjourn?
Motion to adjourn.
Second.
Motion is second. Roll call, please.
Trustees Markwart,
Aye.
Schultz,
Aye.
Schwartz,
Aye.
Williams, Hebda,
Aye.
Cook.
Aye.
Hold it.
You did get that one no, right?
Get that one, did you?
Okay, thank you, and good night.
It was me. I didn't.